future. Before we dive into our sessions, allow me to introduce myself. I am Debanita Shaha, Assistant Professor in the Department of Trauma Care Management, and it is my pleasure to guide you through today's agenda. We have a diverse lineup of topics, esteemed speakers today, all of whom are experts in their own fields. With immense pleasure, I would like to introduce our first speaker, Mrs. Liva Sara Verghese, an accomplished educator, optometrist with both bachelor's and master's degrees in optometry from Manipal University, specializing in low vision since 2020. Since joining Yenepoya in 2018 as an assistant professor, she has significantly contributed to optometry education and received the Best Teacher and Academic Excellence Awards in September 2022. As an associate editor of the university's annual report and Green Horizon bi-yearly newsletter, she demonstrates her commitment to academic communication. Mrs. Liba is actively involved in Internal Quality Assurance Unit and the Curriculum Development Committee, ensuring high educational standards. Her past experience as an NSS program officer and her ongoing work as clinical training coordinator further highlights her dedication to student development. Additionally, she has a postgraduate diploma in medical ethics and bioethics, has guided 4 PG research students, and boasts 3 publications, continually advancing knowledge in her field. Please join me in welcoming Mrs. Liba Sara Verghese for her talk on harnessing feedback for your success today. Ma'am, I welcome you to the dais.
Good morning. You all didn't had breakfast? There is no energy? Good morning. Ayo, still. Yeah, from the back side. Good morning. Okay. So first, I welcome all of you to Yenepoya deemed to be university and Yenepoya faculty of allied health professions. And I am happy and I am also congratulating you that you have secured your seat and you have taken admission in this university. You have come all the way and sitting here for Deeksharambh. You have selected your profession, which area you want to specialize, right? And my first slide is on, I don't want to say rankings, accreditations, because I am pretty sure it will be too overboard for you guys. So I wanted to put, that's why I have put the symbol medal. Can you see that? Yeah, right? So this is the reason you have selected Yenepoya deemed to be university, right? You have heard that Yenepoya is ranked among one of the top universities in the country, right? That is the reason you have come here, you have selected us. So I should tell you the reason how we are maintaining the quality of our university, okay? And all these are external agencies who has given these rankings and medals to our university. if I say that I am good in teaching, that will not make much difference, right? I am only saying good about myself is not good, right? But in 2020, my few students have said, ma'am is very good in teaching and has given rating and best teacher award. That is something which is rewarding, right? Similarly, all these accreditations or all these medals were given to us by the national agencies. Okay? In this, the first one you might have, all of you might be aware, NAAC, NAAC A+, Yenepoya University is NAAC A+ accredited. Are you all aware about it? At least few of you will be knowing it. That is the reason you all have taken your admission here. Like yesterday, that special guest ma'am was telling, ACP ma'am was telling, where you are studying today matters your future, right? So what do you think, how Yenepoya is managing the quality, how we are managing the quality of our education system, right? How we are managing is, we follow a very vibrant feedback system, okay? When you hear the term feedback, what do you think? What is the first word which comes to your mind when you hear the word feedback? Can somebody answer? Any one of you? Anything? Feedback? Nobody has given any feedback to you guys? Feedback means always we will, two things come to our mind. Positive feedback, negative feedback, right? Are you all ready to take negative feedbacks when someone tells to you? No. Always be happy when somebody says onto your face negative feedback about you, because our negative feedback will help us to correct our mistake and to grow for the future, right? So, Yenepoya University is always ready to listen to the suggestions, to the feedback which is both ways, whether positive or negative. We are always ready to take the feedback and we revise our, for example, curriculum or our teaching learning methods. Student has a very big role in giving feedback, and our curriculum committee usually sits and go through each and every suggestion which is given by our stakeholders, and we review and take action. Okay, that is how we manage our quality. We do take feedback from all our stakeholders. Now, who all are all our stakeholders? Now you are student, right? So, stakeholders includes students, our teachers, our alumni. Who is alumni? After your 4 years of undergraduate program, you become an alumni of Yenepoya University, right? Someone who has chosen BSc Anesthesia and OT Technology. After 4 years of graduation of Anesthesia and OT Technology, the person becomes OT Technologist, right? After 10 years of working experience, that person becomes a professional in the Anesthesia and OT Technology, right? So we do take feedback from students, teachers, professionals in the field of your specialization, employers who give job to you when you are working under an organization. Every year we take feedback from all our stakeholders to get their suggestions and improve our curriculum. Okay? So how these feedbacks are collected is, we will be sending Google feedback forms. You will be getting trained on Engage LMS, and your teachers will also help you how to get access to Engage and how to use Google feedback forms, and you will be doing it. And from whom all will take feedback again? From each one of you will be asked to give your suggestions and feedbacks about your course and about your program. Which is the course and which is the program? Okay, program is Bachelor of Optometry, BSc Medical Laboratory Technology. That is a 4-year program. Or BSc Nuclear Medicine Technology. That is a 4-year program. But a course is, for example, you have in your first semester, you have anatomy subject, right? So anatomy is a course. Okay? So anatomy, physiology, medical ethics, all these are courses. So you will be rating or you will be giving suggestions on your overall program as well as your courses. After obtaining the feedback, our curriculum committee will be going through each and every feedbacks and suggestions. We will be consolidating the feedbacks and it will be submitted to the Dean of the Faculty. It will be submitted and discussed in the Board of Studies and in the Faculty of Management, and as per the suggestion, we will be revising or we will be looking forth what can be done for the suggestion. Okay? So this is just a rough diagram where all the feedback forms details are there. All these are available in the Yenepoya University website. It is everything transparent to each one of you. Anytime you can go to the website and see all these 7 feedback forms. In that first 6 feedback forms, you will be familiarized, and the 7th one, which is on the teaching learning evaluation, that is very important. Today we will be seeing each one forms. First one is student feedback on curriculum. Okay, do you know what is curriculum? Yeah, you will be seeing your curriculum Saturday when you have your departmental orientation. That means curriculum is the blueprint of what you are going to learn in this 4 years of your program. Okay, so Bachelor of Optometry, Bachelor of Medical Imaging Technology, any program you take, you have a curriculum. In that, what you learn in the 4 years is well defined. Okay. So, already yesterday our Dean Ma'am has already informed you that we follow here choice-based credit system, right? So, this choice-based credit system is under outcome-based education. From the word outcome-based education means whatever you learn, the content or the course, already the outcome is well defined. For example, the course anatomy. At the end of first semester anatomy course, what you learn in that semester in anatomy subject is already well defined in the curriculum. Okay? So your 4-year curriculum is already planned with a program outcome, course specific outcomes, and all these is connected with the knowledge, skill and your attitude, what you are supposed to develop by the end of 4 year of your whichever specialization you have selected. Okay? So you will be receiving a feedback form, and certain questions will be there in the feedback form that is the learning objective is clear to the student, And you will be given options like agree, disagree, strongly disagree. So if you will be going through the curriculum, and if you feel like the learning objectives are clear, then you will be choosing strongly agree or strongly disagree based upon your wish, right? So already the learning objectives are clearly defined in your curriculum. Then reference materials for the content of each syllabus. Then what are the teaching learning methods? Is the student attain different variety of teaching learning methods for attaining the particular content of the course? For example, when I take class, I am just not standing in front of the PPT and reading the PPT. Okay? My students will be also involved in the class. They will be having group discussion, they will be having role plays. Maybe I might have given the topic one day before and they will be coming and presenting in front of the classmates, right? All these are called as student-centric teaching methods. So, the curriculum was planned in a way that variety of teaching learning methods were utilized for the delivery of the content. And you guys will develop a leadership quality, communication skills, right? So those will be the questions, or those will be the role of students while giving the feedback on curriculum. Next is teacher's role on curriculum. Can you identify the person in the picture? Can you identify the person in the picture? All are sitting very serious. I am getting scared standing in front of this huge crowd. Right? That is myself taking group discussion with my students. So the teachers also will be asked to give feedback through the Google Forms. We are professional in the specialization which you have chosen. So the teacher will be giving feedback on the content of the syllabus, the topics what you are going to study, whether appropriate equipments are available for teaching you practical components, whether appropriate study materials are available for teaching you theoretical components, whether the theory and the practical components are balanced in the curriculum. Then the teacher is trained in using the digital systems. So all these kind of questions will be asked to we teachers. We will be giving our suggestions on the curriculum so that our students will be well trained in 4 years to reach the expectation of the profession. Okay? Next is employers' feedback. So employers' feedback, who will be the employer? After your 4 year of program, you will become a graduate and you will go out of Yenepoya University and you will be joining somewhere as a lab technician or a technologist, right? So the organization in charge, he is your employer, right? I am a staff of Yenepoya University, so Yenepoya is employer and I am a employee. So when you become alumni, you are alumni as well as employee of another organization. So we will be in touch with your employer and we will be asking the feedback with your employer that whether the student is doing the expectation of the employee. Trust me, last week also, we have contacted the employer of our 2018 batch students, and the Google forms were shared to see whether our graduates who are right now alumni are doing best expectation to the profession in their field. So we will be asking your employers, are they developing professionalism? Are they showing leadership qualities? Are they showing team spirit? And are they becoming good in their professional field? What about the research skills of the alumni student? And also their comments or suggestions on the curriculum, what the student or our alumni has studied in our university. Alumni role in feedback. Now, this year, you all will be filling the feedback form of student feedback. For the next 4 years, you will be filling student feedback. Right? After 4 years, after your graduation day, you will become the alumni of Yenepoya deemed to be university. That time, we will be sharing you the alumni feedback form. In alumni feedback form, again you will be asked, did you met with the expectations you had with our Yenepoya University, with our institution? Your overall experience with the program which you have selected, where the teaching and the practical, the theoretical and the practical components were balanced in your curriculum, where you were able to develop teamwork, communication skills, soft skills, research skills. So for developing all this in your 4 years, we have incorporated certain subjects. It's not only like you will be studying only optometry, the subjects, or only the BSc MLT, the subjects. You also have value-added courses. You also have ability enhancement courses such as English and communication, Hindi, then human rights and gender equity. So you will be developing so many skills in this 4 years. Okay. Next is professionals' role in feedback. That is, feedback form will be shared with the professionals. Now I am a professional in the field of optometry. That is because I have graduated by my undergraduation and post-graduation in optometry, and after that I am working in the field of optometry from past 6 years. So I am a professional in this field, right? So I will be able to give more suggestions, or I'll be knowing the specialization, so I know what are the recent advancements in the field of optometry. After completing your 4-year graduation in Yenepoya, in your specialization, then you will be working somewhere. After 5 or 6 years, you will become a better professional than me or anyone in your field. You will be knowing that time what is the recent advancement in that profession than any one of us who is sitting here. Okay. So that is why the feedback form will be shared with the professional, so that they can give us suggestions of the current demand or the up-to-date recent advancement in the field of that specialization. So we can incorporate it in our curriculum, and our students can be taught on that aspect as well. Sixth feedback form, that is the graduate exit feedback. When you are becoming graduate? When you are becoming graduate? 2027 or 2028? You have opted how many years program? 4 years. This is 2024, right? So which year you are becoming graduate? Yes, all of you have received the academic calendar. In that it is written internship completion date September 2028. In September 2028, inshallah, all of you will finish your 4-year graduation and you will be coming for the no-due clearance. That time, along with the no-due clearance, there is one feedback form attached, that is the graduate exit feedback. In that, you will be asked, what was your overall experience in our institution? Has it met with the expectation of when you came? And did you develop any communication skills, leadership qualities, research skills, professionalism? Are you happy with the institute? Right? So all these questions will be there and you will be giving rating to us. Right now you all are sitting here, you have selected Yenepoya University, Yenepoya Faculty of Allied Health Profession because your seniors, they have given 5-star rating for Allied Health Profession and we have gone to the top level among the universities. That's why you all have chosen heard about Yenepoya and chosen, right? Now this is one important feedback, student satisfaction survey. All other feedback forms we will be sending to you either at the end of the semester or at the end of the year, first year, second year, third year, and then your internship ending time. This is student satisfaction survey which the national agency, which is NAAC, has framed the questions of student satisfaction survey. It is usually conducted in the month of May, June, July. That is the red alert time for our teachers, where the SSS is coming. The news will be spread. Student satisfaction survey feedback is directly going to the NAAC. So, right now we are having NAAC A+ accreditation. Once in every 5 years, the institute will apply for the NAAC accreditation. In this, 26 questions will be there. When we apply for the NAAC accreditation, we will be submitting all of your names, your phone numbers and your email ID to the NAAC, and randomly they will be picking some of you and they will be sending this feedback form to you, and you will be asked to fill the student satisfaction survey about the university. Till now, the previous feedbacks, the feedback 1 to 6, whatever I have explained is about mainly focusing on your program and your course, what you are studying, and about your institute. But this student satisfaction survey is about the university. Okay? So at the end of the student satisfaction survey, there will be one open-ended question. Any suggestions? Any further suggestions? So students will be directly putting suggestions about the university, and last there will be rating. 5-star rating, 4-star rating. You can put 3-star, 2-star, 1-star also about the university. The NAAC accreditation, among all the components that comes for the accreditation process, student satisfaction survey has a very big role in the accreditation of university with the NAAC. So usually, previously, when it comes from the NAAC, our students used to do, and we used to get lot of suggestions. But nowadays, every year from the institute side also, we are doing student satisfaction survey so that you all are familiar with the questions that NAAC is sending and you will know what to answer. So, and also we will receive what suggestions our students can put or where we are lagging or where the mistakes are, so that every year our curriculum committee, our board of studies will review the suggestions and improve for the coming batches. So always, whenever a suggestion is given, it will be reviewed and action will be taken. Also, we review the action whether it was effective or not. Okay? So that is how our university and all our institutes of our university do the feedback mechanism continuously every year, every semester with all our stakeholders, and we are ready to receive both positive and negative feedback, and we are ready to accept the suggestions and make the changes for the future. Now I came to the end of the session. At least now all of you can smile. And my last slide, I am hoping you are seeing something is moving in the presentation, right? Are you all seeing? Yes. So at least for this suggestion, my suggestion is, yesterday also you all have received feedback forms for the sessions of yesterday. Today's also you will receive by the end of the day. So please put your feedback about my session also when you receive the feedback form. Thank you so much.
Thank you, Mrs. Liba, for that enlightening session. Feedback is indeed a very crucial tool for personal and professional growth. Now, I request Ms. Adeline Sara Nashama, Program Coordinator of the Department of Physician Associate, to provide a certificate of gratitude for Mrs. Liba for the contribution today. Now, moving on with the event. Next we have with us Dr. Ashwini S. Shetty, an exceptional individual whose dedication to service and education has earned her numerous accolades. Dr. Ashwini serves as the Director of Directorate of Extension and Outreach Activities, NSS Program Coordinator at Yenepoya University, and also as a professor in the Department of Anatomy. Her leadership and organizational skills have been exemplified through her role as the organizing secretary of the National Integration Camp for Youth, which was a great success. She was awarded prestigious the Best Program Officer State Award for 2015 and 16, recognizing her outstanding contributions to the National Service Scheme. Additionally, she has a BA-MS degree from Alvas Ayurveda Medical College, an MSc in Medical Anatomy from Kasturba Medical College, and a PhD from Yenepoya Medical College. Dr. Ashwini has several research publications to her credit and was nominated as the state-level Joint Secretary of the Society of Biological Scientists of India in 2015-16. She also received the Rajyotsava Award for her innovative No Plastic theme in 2012, as well as the prestigious World Art Award by UNICEF in 2000. Currently, Dr. Shetty is spearheading government aimed at conducting NCD screening programs for the tribal population across 5 districts. I welcome Dr. Ashwini to please join us to the dais and enlighten us with her session of orientation to NSS.
A very good morning to everyone. So I'll be briefing on and giving an overview on the National Service Scheme, which is part of our university. So this National Service Scheme is under Ministry of Youth Affairs and Sports, Government of India. This is the youth organization, I could say. Mainly the main objective of this program at our university and all over the country is to empower the youth. Okay, basically we would like to involve the youth in the community outreach programs. So here at our university we have around 64 units and 6,400 NSS volunteers. So NSS is the National Service Scheme, which is under Ministry of Youth Affairs and Sports, Government of India, and it is headed by, at the ministry level, that is at the Government of India, it is headed by the Minister and the Chief Secretary and other stakeholders, as well as at the state level we have the state NSS officer and the regional directorate, and also at the university level we have a program coordinator, one program coordinator, and at the college level the principal who is heading as a chairman of the committee, and we have one NSS program officer for each unit. So we have more than 64 units where around 6,400 NSS volunteers are involved in various activities at the state level, national level, and the district level, university levels. So now coming to what is NSS, as I told you, it is a national service scheme. It is a youth organization and a government organization under Ministry of Youth Affairs and Sports. This youth organization, which is mainly focusing on the youth empowerment and giving more of importance for the community projects. And what is the symbol, what you see here? This is a symbol of the NSS, where you can see the navy blue, which is representing the cosmos of where the NSS is acting as a tiny part, ready to contribute for the welfare of the mankind. The red, where the youth spirit for the activity to organize at the various levels. The giant wheel portray the cycle of creation, preservation, and release, the cycle of life. So that is the symbol of the NSS. You can see in around university all the students wearing the t-shirts, or you can see some of the banners or anywhere in the campus with this symbol. So that is of NSS. Now we have a vision and mission to empower the youth at the different levels. So this vision mainly to empower the youth for the national development programs. So mainly we focus students to participate in various state level as well as a national level campaigns. Maybe it is, we observe many days like important days at the national level. So where we involve more of youth like you all in these activities. And the social upliftment, we involve the students to more focus on the community engagement. We give them many tasks where students must involve with many activities and involve with the community projects. Okay, the next is to holistic personality development and promoting national integration camps. So here we also organize many national integration camps as well as the state level integration camps, the youth festivals where most of the students are a part of these camps, and we focus on national integration among youths. Apart from this, the holistic personality development of the students, where most of the camps where we organize, students get an opportunity to be a part of these special camping programs and the regular activities, which is a part of their national service scheme. And here, these students are involved in various activities. The students stay as a residential camp, where each students will get an opportunity to be a part of this, where they go and expose their talents. So they be a part of individual team with the various activities where they can improve their personality as a leadership, skills and the self-esteem. They can develop their self-confidence. So this is how the overall holistic personality development takes place. So next, coming to the objective of the NSS. So what are the objective of the NSS? First, the understand the community in which they work. Now every unit, for example, even Yenepoya School of Allied Health Science also has a adopted village. There are 20 units at Yenepoya School of Allied Health Science where they have also adopted village. Okay, they have adopted many villages where they involve students' activity in these adopted villages. Okay, so they should know the community which they work. That is the reason where we give them, assign them one adopted villages for the one unit, so that they conduct activity and help them to develop these villages, understand themselves in relation to their community. So you understand the different communities, different people in the community over there, identify the needs and the problems of this community and try to solve them. So students go there and they visit to the schools or PHCs or Gram Panchayats. They identify various problems, and during their 7-day special camping program, students are trying to solve the level of problems at least in their levels. Apart from this, they also develop among themselves a sense of social and the civic responsibilities. Okay, students utilize their knowledge in finding the practical solution in whatever the problems they have seen in the community. So these are all the different objectives, and also to develop a competent required for group living and sharing responsibilities, then gain skill mobilizing the community participation, acquire the leadership qualities and democratic attitudes, as well as the develop capacity to meet emergencies and the natural disaster programs, and practice national integration and the social harmony. So these are our various objectives of the National Service Scheme all over the country. It's not only for Yenepoya University, but for all over the country, the National Service Scheme objectives are mentioned here. Now coming to the organization structure of NSS, as I've already mentioned, for developing and implementation of any activities, as the government is funding for this program. For each unit, for the special camp and the regular activity, the grant what we receive is from the Government of India. So, to develop any activity plans as well as implement these programs, we have various stakeholders at the different levels. So, coming to the Ministry of Youth Affairs and Sports, Government of India, we have a minister for Ministry of Youth Affairs and Sports, and also the Chief Secretary and Joint Secretaries, the program advisors headed by the program advisors. Now, at the state level, we have the National Regional Center, which is located at Bangalore, and he is representing the Government of India. And also the state government, we have a Principal Secretary, Minister for Department of Youth Empowerment and Sports, Government of Karnataka. Under that, there is a Chief Secretary and Secretary for the Youth Empowerment and the Sports. So here we also have the ETI Center, which is located at Mysore, where all the NSS program officers who are appointed, it is mandatory for them to undergo this training, that is ETI training at the Mysore division. Now, apart from this, at the university level, so myself, I am the coordinator for the university, and under us, the Vice Chancellor will be chairing the University Advisory Committee along with the other university stakeholders as a member of Advisory Committee. And we have the 64 now, presently we have 64 units, and each unit we have 100 NSS volunteers. Now, in Yenepoya School of Allied Health Science, we have 20 units. Okay, you have 20 units with the 20 NSS program officers. Now, any students would like to be a part of this program, NSS program, you can be the volunteer for this NSS, and you can contact your program officer. After this session, I'll just introduce all the program officers. Now, each unit have 100 NSS volunteers. Okay. So next, coming to the, now these are the different units which we have. We have Yenepoya Medical College, we have 5 units, Dental College, we have Nursing College, we have Physiotherapy College, Yenepoya Arts, Ayurveda Medical College, we have 1 unit, Yenepoya Homeopathy Medical College, we have 1 unit, Naturopathy Yogic Science, we have Yenepoya Allied Health Science, we have 20 units, and we have Yenepoya Pharmacy College, we have 2, and Yenepoya School of Engineering College, we have 2, and Yenepoya Arts and Science, we have 21 units. So these are the various units in the different colleges, and totally we have around 64 units. Now, the inception of this NSS unit at our university in the year 2013. Before that, and actually it was 2011, where it was under RGHS, and 2013 it was we had 5 unit, okay, with the 500 NSS volunteers. Then in the year 2017 we had 10 units with 1,000 NSS volunteers, and in the year 2022 we have 50 units with the 5,000 NSS volunteers, and in the year 2024 we have 64 units with the 6,400 NSS volunteers. So this is the achievement, the progress of the National Service Scheme from the year 2011, 2013 to 2024. Okay, so these some of the activities I would like to mention here, and major projects which I would like to highlight of the university, because there are a lot of programs which has been organized by various units of our university including our School of Allied Health Science. They are doing a wonderful job, and all the units headed by various program officers are doing a great job by organizing a various impactful projects at the community level. So, but I would not like, I may not be able to, explain everything in a short time, but most of the students I would like to here highlight on our major project which we organize at the level of the university, where all the volunteers of various units are a part of these projects. So these first is the Cancer Awareness Outreach Program, where this is already a completed project where we give awareness on the early detection of the breast, cervical and oral cancer and the general cancer. And so far we are successful in organizing various programs for NSS volunteers across the state and the program officer across the state, and almost 35,000 NSS POs and the volunteers we have covered for the COP program. And next is the tribal population, where we had focused on, that is the NCD, non-communicable disease screening program, and we had covered around 5 districts: Dakshin Kannada, Udupi, Kodagu, Chamrajnagar and Ramnagar, and in Gram Panchayat we covered was 33, and the total camp so far we have organized is 94, and the village covered was 204, and beneficiaries so far till today it was 9444. So these are the beneficiaries in our Kodagu camp, where we use the mobile health screening van, okay, where this is equipped with the pap test facilities and the mammogram facilities. We take this bus to all the villages and every district, and we do the NCD screening, oral screening, pap test and the mammography in this van. Okay, so, and apart from that, there are many other programs which are organized under NSS. That is the National Integration Camp. Students have an opportunity to participate in NSS mega camps, the National Youth Festivals, adventure camps. Students had participated in adventure programs. Your Allied Health Science students also participated. Republic Day Parade, National Youth Festivals. Students have an opportunity for national seminars and workshops to attend. Inter-State Youth Exchange Program, IG Indira Gandhi National NSS Awards. Students can also make an achievement in NSS, and you can get the NSS national level awards and the state level awards. And if you really excel in this, you can also have an opportunity for Indian youth delegation to various countries. So you have an opportunity to go to various countries through this NSS programs. The state level, these are the state level activities. Now we have many recognition, that is national level we have 6 awards, state level recognition 28 awards, and the district level 12 awards. And some of the awards which we would like to highlight, we have received the best NSS unit and the state level university best NSS unit in the Karnataka state, which we received from the Chief Minister of Karnataka. And this is International Lifesaver Award for our best performance in the blood donation programs. And this is the international award which we received for our program officer of dental college. Then state level achievements, our students of university also participate in RD program, that is Republic Day program. Many of our students participated in the Republic Day parade. Okay, so yeah, these are all the achievements. These are celebration of some commemorative days, events. I'm not going to. So we also empower our the program officers and volunteers as academic support. We give a university level Best NSS Program Officer Awards and the Best NSS Volunteer Awards. Even students from School of Allied Health Science, if you perform well, you get an award at the university level, state level and the national level. And also this service is always recognized by the community. You get lot of felicitation from the community. And the NSS development programs, we have a faculty development programs like leadership programs. They can go and attend in the training programs at the NIMANS. This is all sponsored by Government of Karnataka and Government of India. So research support also, we promote every program officers and volunteers for the research. Many of our students from Medical College Dental, they have published the papers through these community activities and the projects which they had involved with. So we give incentives and publication opportunity for the program officers and the volunteers. So finally, what you achieve through NSS, you have an opportunity for community engagement. You will be a social responsibility. You are developing your leadership qualities. You build up your personality and you have an opportunity for teamwork among your colleagues, and you collaborate with the many organization, that is government organization. You have an opportunity to collaborate with the NGOs, and you get to solve the social issues which you come across in the community. You get a networking and social connections by talking and by improving your communication skills with the various stakeholders, personal fulfillment and citizenship education. So these are all what you achieve through NSS. Apart from this, you also have the NSS as the national elective subject, where you can opt for NSS as the subject for the electives, okay, where you get an opportunity for theoretical knowledge as well as a practical experience. So that's about my session, but I would like to, I have not focused here many activities. What I thought, I will just project a video so that you can see all our activities which we are doing throughout the year. So I'll just short video we have. So 2 video I'll project here. One is of our NSS volunteers, and another one is a major project what we are doing in the tribal areas. Okay, so these are the 2 projects. Can you just, yeah.
Deemed to be University National Service Scheme Annual Report 2022-23, 2023-24. In the academic year 2022-23, the National Service Scheme at Yenepoya deemed to be University has not only extended its reach but has also demonstrated an unwavering commitment to community service. With 5,000 NSS volunteers organized into 50 units, the NSS unit has actively engaged in diverse projects, making a significant impact on public health, education and social awareness. The Tribal NCD Screening Project, in collaboration with the Department of Youth Empowerment and Sports, State NSS Cell, Government of Karnataka, the ongoing Tribal NCD Screening Project has proven to be a cornerstone of the NSS unit's community engagement efforts, covering 204 villages across districts such as Dakshina Kannada, Kodagu, Udupi, Chamarajanagar and Ramnagar. The project has conducted 83 camps, screening 7,679 individuals. The NSS unit under the leadership of Dr. M. Vijay Kumar as the principal investigator and Dr. Pratap Lingaya and Dr. Ashwini Shetty as a co-investigator has not only contributed to public health awareness but also ensured that patients requiring further investigations are seamlessly referred to hospitals for proper management. The Granthamitra project, this initiative involves 45 NSS volunteers from various disciplines including Yenepoya Pharmacy College, Yenepoya Physiotherapy College and Yenepoya Homeopathy Medical College. Every Saturday, these volunteers actively engage with the community in 3 Gram Panchayats, providing valuable education to government school students on English, Maths, Science and life skills. The NSS unit has not only taken a proactive role in education but also ensured the training of volunteers under the Department of Youth Empowerment and Sports, Government of Karnataka and RDPR. Approximately 95 school children are benefiting from coaching classes conducted by NSS volunteers under this project. Special camps and practical community engagement. In the year 2022-23, the NSS organized 31 special camps with the 1,860 students participating actively in a 7-day special camp in adopted villages. The focus of these camps extended beyond routine activities including flag hoisting, yoga sessions, guest lectures, cultural program and infrastructure development in school. This approach emphasizes the NSS unit's commitment to practical community engagement and holistic development. The Cancer Awareness Outreach Program. NSS initiatives reached 35,145 individuals across 30 universities, emphasizing cancer prevention and early detection. Training ASHA workers and active participation in outreach programs showcased the NSS unit's dedication to public health. Health and awareness programs. The NSS unit organized 10 blood donation camps collecting over 2,000 units of blood, addressing critical supply needs. Volunteers also donate blood at emergency needs in nearby hospitals. Free health camps and awareness program reached around 2,500 underprivileged sections with a focus on cancer awareness and prevention. National and state level participation. The NSS unit actively participated in the G20 Youth Conclave hosted by NAAC with 11 students representing the university. Additionally, 4 members were selected by the Department of Youth Empowerment and Sports, Government of Karnataka for the G20 Youth Conclave program. In other events, 33 students participated in Youth Conference held at Aloysius College and 61 students attended the National Integration Camp for the year 2022-23. 38 students attended the National Integration Camp in the year 2023 and 24. State RD Camp and Parade participation in 2022-23, 4 members participated in the state RD camp, with the 3 members selected for the state and 1 for the national RD parade. In the subsequent year 2023 and 24, 4 members participated in RD parade selection camp, with 1 selected for the state and 1 for the national RD parade. Awards and achievements. The NSS unit's dedication was recognized with the prestigious Netritwa Award and Yuva Yodha Award for the academic year 2022-23 and 23-24. A volunteer from Yenepoya Dental College received the Best NSS Volunteer Award from the Governor of Karnataka. A program officer and his units from Yenepoya Institute of Arts and Science were felicitated by Dakshina Kannada district for organizing the highest number of blood donation drive. Various programs including Leadership Development Program, Women's Empowerment, Yoga Training, Personality Development, Substance Abuse and Tobacco Prevention, and Road Safety Awareness have actively engaged individuals contributing to overall development. In conclusion, the NSS unit at Yenepoya deemed to be university has not just expanded its numerical strength but has undertaken diverse projects with a profound impact on society. With an ethos of selfless service, community engagement and holistic development, the NSS unit stands as a beacon of positive change, significantly contributing to societal well-being. The numerous projects, collaborations and achievements highlighted in this report are a testament to the unit's dedication to fostering positive change and making a lasting impact on the community. Thank you one and all. The Tribal NCD Screening Camp is a noteworthy initiative spearheaded by NSS Cell Department of Youth Empowerment and Sports, Government of Karnataka, in collaboration with Yenepoya deemed to be university. This project has been strategically launched in 5 districts of Karnataka: Dakshina Kannada, Mudipu, Kodagu, Chamarajanagar and Ramnagar, specifically targeting areas with a high concentration of tribal populations, including particularly vulnerable tribal groups such as Kuragas and Jenukurabas. The primary objective of the Tribal NCD Screening Camp: detection of non-communicable diseases. The core objective of the project is to identify and screen for non-communicable diseases prevalent among the tribal communities in the selected districts. This includes diseases such as diabetes, hypertension, anemia, cancer, cardiovascular diseases. Early intervention: to ensure early intervention and timely medical care for those found to have NCDs, thus mitigating the progression of these diseases and improving the overall health outcomes of the tribal population. Health awareness and education. Apart from screening, the project emphasizes raising health awareness and providing education to the tribal communities. These include educating them about the risk factors associated with NCDs and promoting healthier lifestyles. Capacity building. Building capacity of healthcare professionals, volunteers and community members to effectively carry out the screening process and provide necessary support and guidance. The project's implementation involves selection of target districts. The 5 districts were carefully chosen based on the maximum concentration of tribal populations, with a specific focus on areas inhabited by PVTGs like Koragas and Yenepoya. Temporary screening camps were set up in these districts, equipped with the necessary medical equipments and mobile health units for pap tests, mammography, staffed by trained healthcare professionals and volunteers. The tribal community members are invited to participate in the camps where they undergo comprehensive health screenings. The screening include blood pressure checks, blood sugar tests, BMI measurements, anemia screening and cancer screening. The individual identified with the NCDs are referred to appropriate healthcare facilities for further evaluation and treatment. Follow-up mechanisms are established to ensure that they receive ongoing care and support for free of cost treatment at Yenepoya Medical College Hospital and Zuleika Yenepoya Institute of Oncology, Mangalore. The Tribal NCD Screening Camp initiative is a commendable effort by the NSS Cell, Department of Youth Empowerment and Sports, Government of Karnataka in collaboration with Yenepoya deemed to be university. By focusing on early detection, education and community engagement, these initiative holds the potential to improve the health and well-being of tribal populations in Karnataka's targeted districts. It also serves as a model for similar healthcare interventions in underserved communities across the country.
Yeah, so in all these projects which is initiated by the Yenepoya deemed to be university, we had more number of volunteers from Yenepoya Institute of Allied Health Science, and for all these blood investigations, they worked as radiologists, technicians, where we wanted assistance in mammography, and even many of our volunteers have learned the pap test. So volunteers from Yenepoya Institute of Allied Health Science and the program officers were a part of this projects, what I have projected now. So I hope we will have more number of volunteers this year too, enrolling for NSS. So I wish you all the best, and I request Aditya to introduce all his program officers quickly within maybe 2-3 minutes. I think there's no much time. Shifali is here? Shifali is here? She's here. Huh? Okay. Yeah.
Good morning, everybody. Am I audible there? Yeah. My name is Aditya. I am the program officer from the School of Allied Health Sciences. I'm also the assistant professor from the Department of Medical Imaging Technology. So as ma'am told you, NSS gives you an unique opportunity for a young mind like yours, where you can develop your life skills and then go to the community and conduct some outreach activities. And from the Allied Health Sciences, we have around 20 units. From the Physiotherapy College, we have 2 units. And from the Department of Hospital Administration, we have one unit. So the role of the program officers is nothing but to mentor you, to support you, to conduct all these activities. So like previous year, we had some really good volunteers who were very active, who had those leadership skills. So we expect the same from you as well. So you have 2 more years under NSS. So we expect you to be very active in all the engagement activities. So from Allied Health Sciences, we have 1 program officer currently. So her name is Devanita, so she'll introduce herself. Other than that, we have 18 other program officers who you'll meet shortly. Okay? Thank you so much.
Good morning, everyone. My name is Devanita Shah. I am Assistant Professor in the Department of Trauma Care Management. I have recently become the Program Officer for NSS, and I am actively looking for volunteers, and I hope I will soon be part of the team. Thank you.
Good morning all. Myself Shifali. I'm Assistant Professor in Yenepoya Physiotherapy College. So in YPC we have 2 units. One is headed by me and one more unit is headed by Ms. Swati, who is Assistant Professor in Yenepoya Physiotherapy College. So past 2 years from YPC, we have actively been taking part in all the NSS activities under the guidance of Ashwini ma'am. We have adopted a village and we have been, the major project that we have undertaken is the Grantha Mitra project. So NSS has always been a source or a medium to build the gap that is between the youths and the community currently, and also it builds or it develops the source of the sense of responsibility which is lacking currently in the youths, as well as it also develops the sense of empathy towards each other. So I request the volunteers to actively take part in the NSS activities, which also develops your personal skills along with your professional skills. Thank you.
So we have a great team, the 64 units and 64 program officers, and all of them are very dedicated and hardworking, and we always work as a team. So thank you very much. Let us all work with the commitments and work for the cause. Thank you very much.
Thank you so much, Dr. Ashwini, for your informative session. We appreciate your valuable insights. Now I request Mr. Aditya G. Rao, Assistant Professor in the Department of Medical Imaging Technology and NSS Program Officer, to present a token of appreciation to Dr. Ashwini. As we move further into the program, it is an absolute honor to introduce our next speaker, Dr. Harinarayanan A., an esteemed medical professional and academic. Dr. Harinarayan holds a BHMS and MD in homeopathy from Father Muller Homeopathic Medical College and Hospital. He currently serves as Associate Professor and HOD of Community Medicine at Yenepoya Homeopathic Medical College and Hospital, where his leadership has greatly enhanced the curriculum and student development. In addition to his academic responsibilities, Dr. Harinarayanan plays a key role in administrative capacities. He is the Program Officer at YHMCH, where he actively engages with various programs and initiatives that enhance student and faculty involvement in community health and outreach. Further, as the Nodal Officer of the Youth Red Cross at Yenepoya deemed to be University, Dr. Harinarayanan leads efforts to inculcate a sense of social responsibility among students. His work with the Youth Red Cross reflects his dedication to promoting health and awareness and humanitarian values. Dr. Harinarayanan will be speaking on the important topic of orientation to Youth Red Cross. Please join me in giving a warm welcome to Dr. Harinarayanan.
So, good morning. How are you? Boring? From the morning you are listening orientation to different aspects which is running in Yenepoya deemed to be university, right? Yes. How was the sessions? How was the sessions? Are you happy? No. Why? How many of you are interested to work for the public? When you are professionally qualified, how many of you are interested to work for the public? Whichever course you are selected. You are living in a community, right? So how many of have the responsibility? You can raise your hand. Very less. This is a scenario which is running in our nation. We are not responsible for the public health. Okay? Especially the youth. That's why we are sensitizing the youth. You should be more familiar, more responsible for the public health. For doing that, you should be capable to do yourself in involving certain activities or certain leadership qualities, so you can promote the public, whoever comes to you for seeking and help. I don't know how many of you are professionally related to the medical field. How many of you joined in the medical field? Physiotherapy, imaging technology, optometry. How many of you are there? So when you are doing such courses, you are going to work for the public. Right? Yes or no? So you have to bring that quality. You have to work for the community or society for developing them, so that our nation also grows further. Right? So today our session, which is given for me to sensitize regarding the Youth Red Cross, another voluntary organization like NSS, we are running in our institutions, that is Youth Red Cross. Have you heard about Red Cross? How many of you heard about Red Cross? What is Red Cross? What is Red Cross? What is Red Cross? Where you are seeing that? Anyone? In your lower class, how many of you joined with Junior Red Cross? In your lower class, Junior Red Cross. Have you joined? No. So this is now your right time. You have to take up this opportunity to be a part of Youth Red Cross, because you are the next generation where our nation is focusing for their development. Our nation has to develop, public health has to be improved, so our youth should be responsible for it. So you are the prime area. You have to bring certain changes among you. Okay? So what is Youth Red Cross? What is their roles? How it is formulated in our nation. So initially Red Cross is founded by John Henry Dunant. He is a common man, common businessman, not related with anyone, any medical field. He is the founder of Red Cross Society in our world. Okay? How he found this particular society, or this idea, how it came up for the international level. When he was traveling from his native to France for his business purpose. He witnessed a war field. Okay, it is against France and Italy with Austrian army. So he has saw certain wounded victims where they are not getting any help. So it has provoked a thought. We have to work for such individual where they are not taking care. What is happening in war, you know, right? So the people are affected. They will be throwing out. Nobody will take care of them. So it has been given an impact for that particular person. Later he write a book that is in memory of was Solferino. Okay, in that he mentioned what is happening in the war field, how the victims are affected. Okay, so what we have to do. So this has been taken by the International Health Organization, the one more person who has gone through his work, that is Gustave Monnier. He also suggested we have to develop certain humanitarian background, certain voluntary activities for serving the wounded soldiers or the people who are affected with war. So they came up with an idea that we have to formulate an organization to serve under this particular field. We have to protect the people who are affected. So by this, they formulated International Committee for Relief to the Wounded. That is the first area these two people worked. They formulated certain committee in the sense they have to work for the people who are affected with the war. So they formulated this particular committee, and later in Geneva Convention, okay, this committee has been formulated in the year 1863, February 9th, and later in the Geneva Convention, it has been reformed in International Committee of the Red Cross, ICRC. Okay, in the same year 1863, October 26th. So they formulated International Committee of the Red Cross. So have you seen Red Cross emblem? This you may be familiar. All medical field, doctors, ambulance, everywhere you may see this particular emblem. White background, red cross. Have you seen? Have you seen? So it's actually, this emblem is related to Red Cross Society. White background, red cross. This emblem is working for the purpose of protective action. If this emblem is forced, or if you are carrying this emblem as a badge, or your vehicle is having this emblem, or your supportive area, if you are raising this Red Cross flag, that will give a protection. The people who are working, or the people who are in relation with the war, they won't harm the people who are working under Red Cross. That is one area how this emblem is working. Okay. Another one, this is giving an indication for the other people. Yes, these people are working for Red Cross Society. They are serving for the public. Okay. That is the purpose of this emblem. And we are celebrating Red Cross Day all over the world on May 8th in relation to the birth of John Henry Dunant, who was the founder of Red Cross Society. So what is our role in the Red Cross Society or Indian Red Cross Society or Youth Red Cross? What is our role? What is our area? Certain area is already covered with the NSS. Okay, so Red Cross, I am saying, it is an voluntary organization. NSS, ma'am said they will be getting fund from the ministry. Okay, Red Cross is clearly, or it is an voluntary organization. We have to raise the fund for the population where we are going to serve. So Indian Red Cross Society, it is headed by our president, national president. Who is the national president? Who is our national president? Indian president. You know Indian president? Who? Draupadi Murmu. So she is taking the chairman of this particular Indian Red Cross Society. So we all, when you are joining to Red Cross Society as a volunteer, we are working under the leadership of our president. Okay? That is chairman of Indian Red Cross Society. Another one, it is headed by Ministry of Family, Welfare and Health. Okay, who is the minister? Who is the Central Minister for Family and Health Welfare? See, he is the another leader under national level. Okay? When it comes to the district or state level is headed by the governor. Okay, state governor will be the chairman. Then we will be having the Minister of Family, Health and Welfare. Okay, this is the protocol or structure of Indian Red Cross Society. So Indian Red Cross Society is aimed to formulate Youth Red Cross in each colleges. Government of Karnataka is taken up an initiation to formulate Youth Red Cross in each colleges. Why we are focusing youth? You all are become youth, no? Are you youth? Yes or no? Or still you are a child? +2 under PUC level. Now you came to a significant area where you can work independently. Okay, you have the freedom to work independently. So you can join to the Red Cross Society in your institution. That is, you can join under Youth Red Cross Society and you can work for the community development. Okay? So the area where we are serving is especially in relation to the leadership quality. That is, we are uplifting the leadership skills among you. Then another area is first aid management. Have you heard about first aid management? Have you heard about first aid management? When you are meeting an emergency or disaster, how we are going to support the victims, how we can save the person who are affected with the disaster. What is disaster? What is disaster? One example for disaster. One example for disaster. The flood. Okay? Flood, landslide, even road traffic accident. You are traveling on the road, you are meeting certain accident cases. You have to support the person. You cannot see and you cannot, okay, that is happened. I'll go with my way. That should not happen. So you have to save that particular person's life. In such cases, what we have to do, how we can act, that will be given by the Red Cross Society. You can train. You can get it trained in that first aid management that will be provided by Indian Red Cross Society. In India, only one association can give certificate course under first aid management. That is through Indian Red Cross Society, St. John's Ambulance. These are the two associations who can give certification course. So if you are interested, through the Youth Red Cross, you can take up the training and you can learn how we have to act in an emergency or critical situations. How we can save the public life. That you can train. Okay. Another one will be associating with the programs, the national observations, particular day observation. We have to observe Blood Donors Day, Blood Donation Day, okay, World Health Organization Day, Diabetic Day. So all these particular day, you can associate with other units like NSS we can associate and we can serve for the community. Okay? So this is regarding Youth Red Cross in general. So I request all of you to think. Now you are under youth generation. In our nation, we are rely on youth. How they are working, how they are supporting the nations. So when you work for the nation, your nation also will develop. Okay? So we are focusing on youth and we are making a change. You have to think. Now it's, I can say the ball is in your court. You can decide whether I have to go for any changes in my life. Whether I have to bring certain changes, whether I should have a social commitment, society, you will be living in a community, whether I have to relay with the community. So such a thinking pattern you can have and you can change. You can be a part of Red Cross Society or National Service Scheme. These two areas, they will be promoting your health life. Okay? Your lifestyle will be changed. That can be given under this particular area. So the fundamental principles where we are working, this all quality one individual should have. You should be having humanity. What is humanity? What is humanity? Are you human? Are you human or animal? What is the difference? What is the difference? So you have to consider the fellow being. You should be sensible enough to understand the feelings of fellow being. What they require, you have to support. Okay? Another one, impartiality. What is impartiality? How many of you show the partiality? Partiality. Or I can say discrimination. Any of you showing discrimination between you and your friends? I won't make friendship with this person. I don't like this person. So that has to be removed. That particular sense has to be removed from your mind You should be impartial. Impartial in the sense, you are going to work for the community. Without any discrimination, you should discharge your duties. You cannot consider, okay, this person is not, I don't like this person, or I don't like this community. I won't serve for them. That has to be removed from your mind. Neutrality. You should be neutral. You have to consider everyone in equal way. You cannot give certain condition. Okay, I will be helping this person in prior. Okay, who is required, who has to be taken care, the first preference to whom I should, that you have to decide and you have to work. Unity. Another fundamental role where our nation is saying we have to make unity among ourselves, right? Yes or no? So, when you are taking up as a volunteer, you will be having a team members who are working with you. So you have to work together in one unit or one person. If 10 members are there, the 10 members' action should be united together. Then only you can provide a better care for the community, especially when you are acting under emergency situations. 10 people are rushing to the particular area. 10 people will be having different ideas. Can it be worked out? Can it be worked out? So you have to work for the cause. What is required? All 10 members has to work for it and bring the changes. Clear? Voluntary service. Initially itself I said, this is not a forceful amendment for you. You can think and you can decide whether I should be a part of Indian Red Cross Society or Youth Red Cross. That is up to you. Once you decided, I'll be a volunteer of Youth Red Cross, you have to give 100%. You cannot say, I won't work. Whenever situation comes, whenever the need comes, when we are asking for support, you should be ready. Sometime you may have to support particular person in an hospital with donating the blood. So when you are asking, this particular person is required blood, can you do? If you are not matching with the blood group, you have to work in the unit, find out the person, send the person to the concerned area. So that should be happened. So it's an voluntary service. Independence, we are having the liberty to take independent decision. Okay, but the decision should be favorable for the cause. That cause has to be eliminated. That has to be taken care. And universality, we will be working for the betterment of society. That is, comes under Indian Red Cross and Youth Red Cross activities. So certain activities where we can work, as we are into healthcare sectors. So you can think about health, hygiene and care in the community. First aid management, anyone, it's not necessary that person related to healthcare sector. Anyone who are interested to get trained under first aid management, they can get training under first aid management. They can serve for the community. Disaster response and rehabilitation. For this also, we will be having training under Indian Red Cross. You can get trained. So whenever situation comes in your area or in your locations nearby you, you can act. Then blood donation, disaster preparedness prior to the occurrence of disaster, what all changes we have to do. So that also given training under Indian Red Cross. So in India, the origin of Indian Red Cross related with St. John Ambulance. They were serving in the army field for the soldiers. 1920, March 3, a bill in Indian Council to constitute IRCS. And in year 1920, the Parliament Act has been passed in India. Since then, we are having a Indian Red Cross Society under Government of India, led by the President, National President, and elected members of Indian Red Cross. We'll be having national headquarters, state branch, district branch, taluk branch. So President will be heading the Indian Red Cross Society. Chairman will be Union Health Minister. Vice Chairman elected by the members of Indian Red Cross Society. Secretary General, Chief Executive of the Society. Now we have to focus under College Youth Red Cross Society. Okay, this is all national and state level. Now in your college, Youth Red Cross is constituted under the leadership of principal. Okay, principal will be chairing the unit. Then you will be having a program officers who are selected from your colleges. Then one faculty members for supporting the program officers and 2 student volunteers for each unit. So I think Yenepoya Allied Health Sciences having 1 unit, Yenepoya Physiotherapy having 1 unit. Okay, so you can contact your program officers if you are interested to be a part of Youth Red Cross volunteer. Okay, that is to take part in the activities. Clear? If you are interested to work under Youth Red Cross, you have to be a part of Youth Red Cross unit in your colleges by giving your name or enrolling your name to the program officers. So there will be a fee collection for the volunteers. College unit, if you want to constitute a college unit, you have to pay 1,500, that is one-time payment. In Yenepoya, all the colleges has taken this membership. Now, to be a part of Red Cross, Youth Red Cross member or volunteer, you have to pay a 50 rupees fee per annum. This has been incorporated in your fee structures. No need to pay again. Your fees, whatever is collecting, that 50 rupees will be included. So, what I have to say that you all are part of Youth Red Cross in your colleges. If you want to work, if you shows willingness to work, be in touch with the program officers and take part in the Youth Red Cross activity in an active manner. Clear? So, when you are working in Youth Red Cross, we are getting trained to excel their inbuilt talents and skills. What is explained under NSS, same way, you will be equipped with leadership qualities. You can be a good leader for the community. You can give awareness to the public, health awareness or support to the public. imbibe the humanitarianism values in the young minds. So certain activities you can do awareness program against HIV or AIDS. You can sensitize the community how AIDS is getting transmitted, how people are getting infected. So such awareness program you can do. Awareness campaign on hazards of drug addiction. In our university again we are having one more unit, that is substance abuse prevention cell. When you are taking admission, you might have submitted the one pledge. You won't be using any substance whenever you are staying in the campus. So that also awareness program you can give for the public, what is the hazardous effect. Then providing first aid management under critical situations that you can give, or when you are getting trained or when you are doing the certificate course in first aid management, you can be a person to train others. You can take a class for other people under first aid management. If you are taken a certification course, the certificate has to be valid for 6 months, and it is having a fee for taking part in the training session. Dissemination of Red Cross movements, developing friendship, state and national integration camps. As like NSS, we are also having national camps and state level camps. We will be having quiz programs, district level, state level, national level quiz programs will be there. So the people who are interested, you can be in touch with the program officers and you can take part in the programs. So this is college level committee. So if you are not aware about Youth Red Cross, if you are interested, you can be in touch with the principal. So sir will be or ma'am will be giving who is the program officers in your stream. So you can be in touch with the program officers. So main core activities under Youth Red Cross, that is, we will be giving an orientation. When you are taking up the volunteers, okay, you are registering as volunteers, Youth Red Cross unit will be giving an orientation program. What all area we have to work, that will be given. Then first aid management training will be given. Disaster management training will be given. And you have to take part in blood donation day, blood donor day, or national observation days. Okay, whatever days we have to observe, all those activities you have to participate. Then, according to the Indian government, you might have heard about Swachhata Hi Seva. Okay, now the seconds we have to do this particular day observation, Swachhata Hi Seva. So that also we have to work. Then we are having district level activities, National Youth Day, Jada, district level quiz competition, district level camps, disaster relief, distribution and SCRV team training. We have to train under this particular session. State level, we are having state level quiz sessions, national level youth festival, then national camps we are having. So when you have time, now this is a sensitization session. If you are getting a time, you can just refer what is Red Cross, what are the services they are providing, what is the role of Indian Red Cross in our nation, Youth Red Cross role. That you can Google it and see. Okay? So once you become of Red Cross volunteer, you should be available round of the clock. You cannot say no. Okay? So that is, we cannot predict when emergency situation comes. When we are in call, you have to be served. So this is regarding Youth Red Cross organization. So I request all members, you are a part of Youth Red Cross Society once you are joining into the Yenepoya deemed to be university. Apart from that, if you want to actively participate under the activities, be in touch with the program officers, concerned colleges, and give the name. So program officers will be giving that name to the nodal officers, and you will be selected for such activities. Quiz competition or camps or any other programs we are conducting under Red Cross banner. That will be considered. Thank you.
Thank you, sir, for your enlightening nation. Your leadership and dedication inspire us all. Now I request Ms. Akshita, Assistant Professor from the Department of Cardiovascular Technology and Program Officer, Youth Red Cross YSHS Unit, to provide a token of appreciation to Dr. Harinarayanan. Now, moving on, I am delighted to introduce our next speaker, Mr. Prabhakar A., a dedicated professional in medical laboratory technology. He holds a master's degree in MLT, specializing in microbiology and immunology from Manipal Academy of Higher Education, and completed his bachelor's degree at Father Muller Medical College. Currently, Mr. Prabhakar serves as the Program Coordinator and Assistant Professor of Microbiology at Yenepoya, a role he has embraced since June 2023. Prior to this, he contributed significantly at HCG College of Allied Health Sciences in Bangalore. He is a key member of the Scientific Review Committee. With experience as a medical laboratory technologist at Anand Newberg Diagnostics, Mr. Prabhakar has excelled in scientific research, coordination, and editorial assistance, notably with the Journal of Precision Oncology. He is proficient in microbiological techniques and has hands-on experience with advanced laboratory instruments, further complemented by a certificate in good clinical practice. His dedication to education and research is further evidenced by his training on meta-analysis and overseeing publication processes. Please join me in welcoming Mr. Prabhakar on the dais for his talk on Knowledgeness, Digital Learning in New Age.
First remove that photo. Yeah, that is a passport size photo of mine. I didn't have anything else. Good afternoon. Too much talks? Too much in your brain? Going above your head? Okay, can I ask all of you to just stand a moment? Yes? Ready? Turn to your left. Turn to your left. To your right. To your left. To your right. To your left. Wave your hand up. Yes? And have a hearty laugh. Awesome. Please sit down. Please take your seats. now that you all have some bloods running to your body, to your limbs, I think you'll have some more concentration. The talk is going to be very simple. I'm not going to extend it much. And this is something which you all have to know because you all belong to the 21st century, Gen Zs. Yes? What is this? Don't have to answer. I just asked because it looks like an interaction between you. All of you have mobile phones, right? What do you use it for? Instagram, Snapchat, status WhatsApp. Yeah? I belong to the generation of Orkut, Facebook, and all those Yahoo messengers. Irrespective of having this mobile phone in your hand, most of you have iPhones, some of you have good phones, you know, Androids costing about 30,000. What is it that you actually do with this mobile phone? You guys all have the mobile phone, except for texting, except for chatting with your friends, or watching reels, YouTubes, and all those things. Anytime, any point of your life, have you ever used this phone for anything that is useful? How many of you raise your hand? Useful. As in? I'm not talking about studies here, okay? Maybe volunteering for some social service, all right? Or going for a blood donation because you saw a message in the WhatsApp and you're supposed to go replace blood, going for the blood donation. Or maybe just to help a friend who is apparently, I see most of my students saying that tire puncture. Going to pick up your friend because the friend has a tire puncture. Some of you have done this? Yeah? Awesome. Digital learning, knowledge nest, is basically a new age learning. What you are supposed to do here is nothing but use that beautiful mobile phone that you have in your hand and get some knowledge which you cannot get sitting here. That means you're going to get the knowledge which someone from Germany, someone from USA who can teach you, who cannot come here in physical and teach you. You know, you get those knowledge from them. It's basically a concept where you're going to use virtual learning interfaces and get some degree out of it. When I was studying, I did not have the facility to go and do multiple courses. I joined my BSc. I had to be in my BSc from 9 to 4 o'clock with my postings. Now, what did I gain out of it? Theoretical knowledge. Everybody gets that. Yeah? If you teach a class of 100 students for 1 hour, 100 students, out of them, only 70 of them will be able to actually listen to your class. Out of the 70, only 50 of them will be able to actually rewind or remember back what was taught. And only 30 of them will be able to write it on the paper with few mistakes. You understand the difference? Irrespective of teaching for 1 hour, same amount of time, 100 students. How many are actually writing it on the answer script? How many? 30? So that is where this helps you. Digital learning platform basically helps you to study things in real time as well as in your own pace. You want to study every day between 5 o'clock to 5:30, half an hour. Your concentration level is that much. Mine also, same thing, 30 minutes to 45 minutes. If I teach anything more than that, or if I sit for anything more than that, it goes above my head. So every individual sitting here, you have your own concentration time, which you have to identify. That is where you have the benefit of the digital learning. You can use online platforms. Instead of watching YouTube's reels, at least spend 10 to 15 minutes in the YouTube, you search for something related to your studies. Nowadays, you got so many videos, and something that I quite often see among students is inability to talk English or inability to understand what is spoken. You don't have to always study things in English. You can study in Malayalam, you can study in Hindi, you can study in Tamil, you can study in Kannada. Wide variety of options are available, but only if you are interested to learn something. If you are hungry, you always learn to cook something. And what we always cook, hostelites, it gets done in 2 minutes. What is that? Loudly. 2 minutes? Maggie, right? Unless and until you know you have to boil the water, put the powder, put the masalas, put the Maggi, then only you will know to create it. And then only you can satisfy your hunger. Yes? Same way, if you do not have the hunger to learn, you will not learn anything. It creates a virtual classroom. What is this virtual classroom? With the developing AIs and developing technologies, you basically can see the classroom using a VR headset, virtual reality headset. You just have to wear it, you can see it in front of you. This is the concept that is being developed. Similarly, you can also study stuff based on the 3D model platforms. Again, these are something which are developed and are in use, but not in India. We have all these things in use in abroad countries. But in India, we have the videos that are being recorded, which can be seen in variety of online platforms. I will be talking about a few of them, which is nothing but the Coursera and Swayam. Two important ones which you will be studying or which you will be utilizing throughout your undergraduate course. Coursera, it is one of the widest known platform which gives us free course. Say now you are at Yenepoya University and you want to study some topic that is there, say USA or Stanford. You cannot go to USA or Stanford and study. But this helps you to learn from the faculties of USA and Stanford. That means Coursera is a platform which integrates the courses provided by other faculties across 300 countries, 300 universities. These 300 universities, all the faculties have higher end technology. What you'll be studying as, say, anatomy, what are the different bones in the body, you may be able to visualize them in the video with the 3D model. Picture speaks 1,000 words. A picture is easy to remember than a one long para. That is why I'm not looking at any of the sentences that I put on the slide. That is for you to read. What I want to say is a different thing. I just take keywords from there and I explain to you. Next, we have, the key features of the Coursera is, you can get the certificate. In Yenepoya University, we are accepting the certificates of Coursera. You can also learn it as you can. That is, whenever you want to. If you take one topic for 1 month to learn, you can learn this in 1 month. Okay? And you can also get a career advancement. That is, imagine you are belonging to AOT or you belong to MLT. There are a lot of advancements in these fields. So AI, artificial intelligence and machine learning is something which everybody learns, right? Everybody knows about this. You have come across all these things, correct? Anybody knows about this? AI, machine learning? It's coding basically. When we studied, including both of us, we never had AI in the school. But now coding is a part of school curriculum. That means we can make robots do our work. How do we make them? Is taught in the AI. This is one example which you can try to identify and study, and how you implement for your course is what is important. Because most of them are doing this, and Indian government has to take a step on this. We can't simply say, no, USA is doing, UK is doing, China is doing. I can't say that I don't want to do. Because if Indian government says that, what will happen? Next election, Modi will not be the Prime Minister, right? So because he is Prime Minister continuously, why? He has got some implementations like this. Swayam, a government of India recognized online platform for any Indian citizen. You can do any course in the Swayam platform. This is a second platform that we accept in Yenepoya University. What does this platform do? This also gives you the common topics that you can learn. You might be from AOT and you want to learn about microbiology, or you want to learn about molecular biology. Take up a course here. So in India, we feel knowledge should be, very easy to get access to. Swayam follows the same concept. You can enroll for free, but if you want a certificate, you have to pay for it. Because Indian government also wants some money to run the Swayam platform. So you have to pay for the certificate received, but you can join for the courses. A nominal fee of 500 to 1,000 bucks is what is charged for the certificate course. In Swayam, you will have to undergo the online classes, but exam is a proctored exam. You have to go to a hall, write the exam, and come up. Whereas in Coursera, it is not a proctored one. You can do the courses online. That is, the exams are also online, a multiple choice based questions. We have implemented both of these for something called as credit-based system. All of you are coming under the credit-based system. Now you'll be wondering, why am I sitting here from morning till afternoon listening to all these things, NSS, Red Cross, why am I doing? See, these are the things that is going to make you a better human, better Indian citizen. You just not only have to focus on the classes, but also some basic concepts as a citizen. And that is where this credit-based system comes, which helps you to get credits, not just from the core courses, but also from the other subsidiary courses. And all these credits are implemented in your curriculum, which you have to get it mandatorily. So that when you finish off your course, imagine you take a course, a Coursera course in psychology, and say you have got a credit, say about 30 credits. You attended 30 hours of class, you got 30 credits. Now that may not be useful for a MLT student, but post your BSc, if you plan to take a psychology field and you look for a college that has a psychology field, and one of their topics or one of their subject is which you have already covered in the Coursera, you just simply have to present the certificate to them, which accounts for the 30 credits that you have taken. You don't have to sit for that class. You don't have to physically be present for that class. You can attend the remaining subjects and you can get the certificate for the entire degree. This is the concept of credit-based system. This is how it is beneficial for you. When you are studying your BSc, you can also get another BSc degree. You can get a dual degree, which will benefit you in your career. And that is what is given in Coursera as well as in Swayam. In university curriculum, we have all these sections, and we are going to provide you Coursera licenses. Yenepoya has got Coursera licenses for the students of allied sciences. We will be giving you the licenses. Make good use of it, because when you go by yourself and get the license, it will cost you around 4,500 to 10,000 rupees per license per course. But we give it for free of cost for all the students so that you benefit from the extra learning hours. Challenges when it comes to studying, especially in Indian students. Number one, I am in my Natilana, there is no network. Network issues. This is one of the major challenges that we face with students. Internet access is available. We are right now in the 5G era. That means even in the non-networkable area, you will be getting 2G to 3G network. You might have some difficulties, but you will always be able to complete the courses. So this is one of the challenges most of the students face. Second challenge is digital literacy. Even though we have mobile phones in our hand, we do not know how to use them except for Snapchats and other social medias. Digital literacy talks about how well can you implement the technology, and that is another challenge that is present in the digital learning. Self-discipline and lack of interaction. Self-discipline, you start a course, we have to complete the course. This is self-discipline, which few of the students don't account for. You should always note that if you're going to start something, please finish it off. That is a common courtesy which you can give to yourself. Otherwise, you yourself will start considering that, oh no, I cannot finish any task that I'm going to take. So self-discipline is very important. And secondly, lack of interaction. You cannot do a continuous interactions with the faculties. Okay, the days of one faculty or one teacher teaching 20 to 30 students are over. You have to improve, you have to adapt to the growing technology. That means you have to start learning by yourself. So the interaction between the faculty and the student will be reduced in the online platform, which is another challenges. Okay, because some students prefer that faculties come and talk to them directly, explain to them directly. A face-to-face human interaction is needed. But I'm pretty much sure with the amount of mobile usage, I can tell you that all of you will be able to access these courses at least for 30 minutes in 2 days or 3 days, right? So this lack of interaction may not be a problem right now, but still some students might face. So you have to identify yourself, whether you belong to category 1, where you are able to handle, or category 2 where you want help from a faculty. Accordingly, you can reach out to the faculties. Embrace digital learning, because today you are here studying the course. Amongst you, there might be another student, your another fellow student, who might be smarter than you, utilizing all these online courses. And when you go stand for a job, they will be picked up before you. That is when it hurts the most. So don't be left behind in the race. Try to achieve your goals at your own time. That is very important, okay? A small, short one. That's it. Claps are awesome, but at least take home message. You will be given Coursera. Please utilize that when you start your classes. Yeah? All right? Thank you. Sorry?
Thank you, Mr. Prabhakar, for such an engaging and insightful session. Your expertise in the digital transformation of education is truly valuable. Now I request Mrs. Shifali, Assistant Professor, Yenepoya Physiotherapy College, to present a token of appreciation to Mr. Prabhakar. I request students to be seated in their place. The program coordinators and coordinators of the batches should take the attendance if not already done. Lunch will be served shortly. Thank you. Everyone, boys sitting in the gallery, please go for lunch in the left counter, left back side of the stage, counter number 2. Please don't rush. Please maintain a line and go for lunch. Girls, please wait for a while. After the next announcement, you can go. Girls, please wait. Faculties, please look into that. Girls should wait. Their lunch is not ready yet. I request the faculties, please look after their students.
Counter 1, counter 3 and counter 4.
Girls, please form a line and take your lunch from the counter 3 and 4.
Please do not rush
Please don't rush. Food will be served.
for everyone.
Girls, please don't form crowd. Food will be served from everyone. So please maintain a line. Boys will be taking food only from counter 2, not counter 1. Please go to the back side. Faculties can take their lunch from counter 1. For faculties, lunch is served in counter 1. Good afternoon, everyone. Please settle down. I request all of you to please settle down. I hope all of you enjoyed your lunch and had a chance to recharge. We are shortly starting our post-lunch session. Allow me to introduce our next speaker, Dr. Leena Casey, the Dean and Principal of Yenepoya Nursing College at Yenepoya Deemed to be University. A highly accomplished nursing professional with extensive experience in academics, clinical practice, research, and professional development. She holds a PhD in nursing from Rajiv Gandhi University of Health Sciences with a focus on community health nursing activities. Her academic journey also includes a master's degree in community health nursing from Father Muller College of Nursing and a bachelor's degree in nursing from Government College of Nursing, Bangalore. Dr. Leena played pivotal roles in NAAC accreditation for the nursing college and NABH accreditation for the hospital, contributing significantly to nursing education, curriculum development, and infection control. She has been involved in multiple research projects, including ICMR and RGUHS funded studies, and serves as a guide for UG, PG, and PhD students. In her teaching career, she has guided undergraduates and postgraduates, particularly in community health, nursing education, research, and administration. Dr. Leena also contributed as a resource person for over 70 seminars. So I welcome Dr. Leena on the dais for her topic, Orientation to Gender Sensitization, Internal Complaint Committees and Women's Safety for today's session.
Thank you. Very good afternoon to all of you. And I'm sure you had packed sessions in getting adjusted to Yenepoya University, its policies, guidelines, and everything. So through Deeksharambh program, you will be able to adapt well to the environment and to be highly accomplished professionals who will grow every day and contribute back to the society and become competent professionals. So in this journey, it's also important that we develop right attitudes to ourselves and to our surrounding. So in that context, I think it's very important for all of us to respect everybody, irrespective of caste, creed, religion, and above all, gender. And our understanding of gender may be limited, that we only think of boys and girls. But we know that gender includes men, women, and so-called others, or the transgenders. So they need not be confined to either male or female gender. And there is a lot of development that has happened through right activists who work towards transgender rights. So if we are someone who thinks that it's only male and female, and you come across transgenders at roads, in the trains, or in our own classrooms, we shouldn't be wondering that they have no rights, and it's only the male and the female who will have right to live, right to have education, right to have employment. Then our mindset is very much constricted or restricted. So we must be accommodative of these people who do not define under gender male or female and be identifying themselves as others. So if you are tolerant of your classmate who is a transgender, or your teacher who is a transgender, or any of our university employees who are transgenders, that means we have right attitude towards gender and equality. Because we should be able to give opportunities for everybody to study or to work. So this is what we need to train our mindset. So if you understand this, you will not be teasing a transgender or making fun of a transgender or turning away a transgender who has come to seek healthcare in our hospital or come to study in our university. So let us acknowledge that there are some others who are not defined under male or female. And it's not just about others. And what is important for us is also to understand whether male and female are equal or equally treated. Now, if you look at this hall, we may think that we are gender biased and men are minority and more girls are here. If it is so, it's because of the privilege that we have had all these years. Maybe your parents were supportive, your society was supportive, the university is supportive to take more girls. You are empowered or you are privileged. But even in this classroom where there are, in this hall where there are more girls and less boys, the struggle that a boy had to reach to higher education and the struggle many of the girls had to reach here is different. It's because of the patriarchal mindset. Maybe many of these girls were told, it's not necessary for you to go to a professional college. It's okay, you stop studying. Some of them had to fight, some of them had long struggles to join your class. So as gender sensitive individuals, it's very important for us to understand, due to the inequality in society, people have gone through a lot of struggles to reach here. Let us not be the reasons for any girls or transgenders to discontinue their studies or quit working. It's not just about studies. All of you, say thousands of you, you come across thousands of people every day in different walks of life. You meet your family members, neighbors, classmates, or our clients, patients, many people. And this effort to sensitize about gender should be an ongoing process so that we can make societal changes. And that is the aim of the gender sensitization cell at Yenepoya University. And this gender sensitization cell was developed as per the instructions of the University Grants Commission and Higher Education, wherein the privileged and educated will be getting involved, changing their own attitudes and bringing about changes in society. And through this cell, each college, even the Allied Health Sciences College, has gender teachers who are part of the gender sensitization cell. They will also be asking gender champions from each of the classes, which includes both boys and girls, who will be ambassadors in bringing about this change through various activities, be it in the classrooms, competitions, organizing talks, or performing outreach activities. So in that context, Can I move this? This also not moving. So all the information what I'm going to talk today is available in our website of the university, where there is cell tab, under that gender sensitization cell. All our SOPs and what are the guidelines in selecting a gender champion, who's a gender teacher, what are the roles and responsibilities, what are the different activities that we have done over the years is all there in the website. You can refer to that. Now, why do we sensitize about gender? It's because we want to make a gender inclusive society where there is no differentiation. And we have to be change agents. And in this process, educated youth will be playing a crucial role in bringing about such changes. And this will improve the status of transgenders, the status of women. More women will come for studies, more women will take up employment and become productive individuals who will be contributing to our economy. So in this context, we need to understand what are the patriarchal mindset. Many times we come across incidences is changing, I think. So if you look at this picture, now, even if you don't look at this picture, you have seen what has happened in the recent days. You have seen the incidents that has happened in the Kolkata Medical College Hospital. How a woman doctor was brutally assaulted sexually and killed. And earlier we had incidences wherein the woman in Manipur was gang raped in public. And then earlier to that we had the Nirbhaya case and many more such cases. So we find that women are not safe. If women have to be safe, then people should be sensitized. That women should not be viewed as sexual objects and respect the rights of every individual. And as the victimization is increasing, or as the victims are talking more, or incidences are getting reported, we also find that there is growing assertion among women to protect their rights. So you find, what is going on in the film industry. Say earlier there was that Me Too campaign. Now you see in some states there are a lot of incidences of women coming out and reporting about abuse they face in the particular industry. It's not just limited to such industries, it's there everywhere. So what is important is to protect ourselves from such things from happening. So if such incidences are happening, it's going to reduce enrollment of students into higher studies. Say if a postgraduate doctor was not safe, do you think some simple person who is doing maybe graduation is safe. So because of this, enrollment ratios can come down. Because of such incidences, many families may not allow their women to go out and work. So ultimately it is having its own implications to the society. So therefore, it's affecting capabilities. It's also affecting livelihoods. Women may not be able to have access to work. People may prevent them from getting... So we find these sort of problems. And when it comes to political representation again, you find that political representation is not enough. Although it is proposed that you need to have 33% reservation, still it's not in practice. There is a deadline that is given again. So what if 33% is given? Because women are nearly 50%. So these are all questions that we need to emphasize when we talk about gender sensitization. And if women are elected, whether women are the ones who are actually exerting power, or it is their male relative, say husband or family members who are actually playing the role of a leader. So these are all concerns that are there which needs to be addressed. So we can understand from this that there is definitely a gender gap, and because of this there is also violence against women. Women are not considered equal. And if we have societies where women are brutally treated like this, it is also indicative of health of our society. So therefore, let us be very much vocal and bring about changes in society so that this inequality can be bridged. Starting from our own homes to our classrooms and our neighborhoods and country at large. So because of this, there is violence that is happening. And when violence happens, even then you find there is patriarchal mindset. Now, when famous cases what I mentioned happened, there were so-called leaders who had vast following, who made these sort of remarks, which said that women should be confined to the homes, girls should not go out, girls should not work, why send girls for studies? So these all things show that there is patriarchal mindset. So many men here, whether you have this sort of mindset, if you have, you need to change, because this is going to affect the society at large. Let us be more inclusive and broad-minded and progressive, so that women are also able to perform their best in whatever spheres of life that they choose. So when it comes to sexual division of labor, there also you find the problem that women are to do certain jobs, men have to do certain jobs, or women have to do everything at home, men will be only providers. Or if it is in your own classroom, if a student leader is to be elected, you think that only boys can be student leaders, girls can't be student leaders. So these are all mindset that we need to change. We have to really appreciate the talents or leadership abilities. Not just the gender should be the focus. So what is the effect of discrimination? As we mentioned, more people are going to stay out of schools or colleges, more of unemployment, very limited involvement in decision making, poor health, poor nutrition. These are all consequences, ultimately resulting in declining sex ratio. That is the reduction in the number of girls in the society compared to boys. So I already mentioned about why we need to sensitize and what the gender cell has got to offer at Yenepoya. And you can read the website and learn more about what the cell has got to offer and how each of you can be part of the activities. There are a lot of activities that each of the constituent colleges are doing. Competitions. So if you participate in whatever you are good at, you can win prizes. There are cash prizes, there are recognitions that are happening. So please get involved in the activities. Don't think that only girls can participate. Both boys and girls can participate in such activities. So that's about the gender cell at Yenepoya, deemed to be university. Now moving on to the next topic. I can't do it here. It's not moving properly. No, I am. So next small topic that we will be discussing is about prevention of sexual harassment. As a background, we discussed about the gender-related issues. Now let us see what is this committee about. This committee is a statutory committee, which is a must in organizations, where it is dealing with employees and students in an educational environment. And this committee is a committee that is protecting or preventing sexual harassment from happening at workplace and in colleges. So if at all there is sexual harassment is happening, there is a provision for aggrieved person to file a complaint and it will be investigated. And it has legal standing as to how the committee does the investigation. So let us see a little bit about what is sexual harassment. So the most important slide out here is what are some of the behaviors which can be termed as sexual harassment. Sexual harassment is not only about the cases that I mentioned, whereas ultimately they were gang raped or killed. This is not just the definition of sexual harassment. There are a list of behaviors which can be considered as sexual harassment. I want all the boys to be more attentive. The reason why we are educating you all here is so that you will be free from such stress of people complaining against you. Because some of these behaviors, in the general sense, we may not consider they are sexual harassment, but they are actually coming under sexual harassment. The first behavior is making sexually suggested remarks. You find it in movies where the hero will comment about the heroine or the villain will comment about the heroine or somebody like that. And maybe they will just laugh it off, or they later become friends. Maybe they will get married or something like that. But in real life, if somebody is making sexually suggestive remarks, it can be termed as sexual harassment. I may be okay with that comment, but the girl out there is not okay with it. So it's about individual and individual's perception. So if the girl feels it is sexual harassment, the girl can file a complaint against you. So therefore, don't make sexually suggestive remarks. Second is serious or repeated offensive remarks, like teasing the girls. We find it happening regularly in all movies. Consider it is fun, but it is not fun for some girls. If they are teased, if their comment is made about their body, about their appearance, some girl can file a complaint. So be mindful of what you do or how you communicate. Third behavior is offensive comments or jokes. You find people joking. Some girl doesn't find it funny. They find it offensive. They find it embarrassing. It's not just about communicating the joke. It may be also forwarding the joke. There are boys in the group, girls in the group. The girl may feel offended. One girl is offended, that's enough. The girl can file a complaint. So this is about offensive jokes. Next is inappropriate questions, suggestions or remarks. What are inappropriate questions? Inappropriate questions about whom she is with, whom she is married to, what is the sexuality, sexual preferences, and things like that. It's none of your business. Because if the girl doesn't feel good about it, the girl can file a complaint. So you have to really think whom you are talking to. Next is displaying offensive pictures, posters, SMS, WhatsApp messages, emails. At least those of us who are very casual in forwarding whatever we get in our mobile phone or email, we have to be conscious about this. Because you may have simply forwarded, but I think your intentions are different. Then I can file a complaint against you. So you may be wondering now how to live in this society like this, how to live amidst all these students, classmates. It's not that day to day your communications are affected, but when it comes to sexuality, sexual matters, or such behaviors, you have to be extremely careful. Next is threats, intimidation, or retaliation against who speaks up about the unwelcome behavior. You send a message, I say I'm going to complain. Or you have my photo, I say that if you don't delete, I'm going to complain. Or you follow me, I say I don't like it, I'm going to complain that you are a danger to me. So what do? You say that if you complain, I'm going to kill you. If you don't come out with me, I'm going to throw acid on you. Or any such threat you may give. Now, this may be quoted against you. And the girl can file a complaint of sexual harassment. Next, intimidation, threats, blackmail around sexual favors. Now, I have your photo. I'm going to morph the photo and circulate in social media. If you don't come out with me, this is a threat. This is an intimidation. So the girl can file a complaint. because they may have the communication that you have done with the girl. Unwelcome sexual advances, which may or may not be accompanied by promises or threats, explicit or implicit. So if you come out with me, I'll give you diamond. Or if you come out with me, I will pay the college fees. I will take you for a tour. These are all sexual advances. If it is not, many girls may not think like that, but some girls may be thinking like that. So, in favor of sexual unwelcome social invitations, commonly understood as flirting. Let us go for a disco. Let us go for this night party. Or let us go for a tour. Or you come to my home. So, social invitation may be misinterpreted. Therefore, communicate properly. Physical contact such as touching, pinching, caressing, kissing, fondling against the will of a person. So, will is important here. Against the will of a person. If it is consenting individuals, nobody has a problem. But if it is without will, the girl is definitely going to create problem for you. And next is invasion of personal space. What is this personal space? We always keep a safe distance between people of the other sex. Some safe distance. I wouldn't like any men to come so close to me and talk to me or touch me. That distance has to be respected. It's also true about the physical space that we have. For example, if boys are found near girls' toilets, it's definitely not something that is welcome. Or in your own colleges, you have rooms meant for boys and rooms meant for girls. Girls' common room. Girls' common room is not a place where any boy should be found. There may be some girl who says, you come to girls' common room. But please don't go to girls' common room or anywhere near to girls' common room. They may say, you come and give me this. Please don't go. Because it's going to cause problem. Persistently asking someone out despite being turned out. Now come, let us go for this movie. I say no. Come, go for next movie. You call today, call tomorrow. If I say no, no is no. You should not be trying to persuade me and take me, because I am going to cause trouble. Stalking an individual. Do you know what is the meaning of stalking? Stalking is where, say, for example, there is one person with whom I am friendly, maybe, or some sort of attraction is there. Now, that person doesn't like me talking to another person. That person will be following me and watching over me. If that person can't be there, that person will appoint another person. You just watch over this person with whom she is going. So, it could be also about use of mobiles. Whom I am calling, with whom I am talking, how much I am talking. So, somebody else wants control over what I am doing, with whom I interact, with whom I spend time. So, stalking can also be done to find out how long you were online, with whom you were chatting. Show your emails. This is like intrusion of somebody's privacy, and if it is having sexual overtones, definitely the girl can file a complaint. Next is abuse of authority or power to threaten a person's job or undermine performance against sexual favors. This will not be happening for students, but the students out here should know that it's not between students. It could be between your professor and you. It could be between your senior PG or seniors and juniors. So if some teacher says that if you give me sexual favors, then only I will correct your project. You will get internals only if you do this. You don't have to be worried. You can definitely file a complaint against such people because those people don't deserve to be in our workplace or in our study environment. Controlling person's reputation by rumor mongering about private life. We know there are people who spread rumors. But if it is about character of a person, if it is about the values that the person holds, and simply create stories and spread that, put it in Instagram, put it in WhatsApp, or spread it to classmates, put it up on the, in the college notice board as a poster or something. This is not acceptable. So if somebody is doing it, it may be termed as sexual harassment. So these are the list of things which are definitely called as sexual harassment. Now I'll be just mentioning some of the behaviors which has the merit of inquiry. If any of these behaviors which I'm going to say are there, there is a possibility that it is sexual harassment. So the committee will investigate and find out if it is sexual harassment. The first one is criticizing. All the time criticizing, insulting, reprimanding, blaming the other person in public. You are like this, you are like this, you are good for nothing. It may be with the intention of sexual harassment. But we need to investigate to confirm it. Next is exclusion from group activities, assignments or without any reasons. Third is statements damaging person's reputation and character. That the person is inefficient, that person is not able to communicate, not efficient and things like that. Removing areas of responsibility. Saying that so and so cannot be in that particular work. Inappropriately giving too much work or too little work, constantly overruling authority, not following, unjustifiably monitoring everything that one is doing, like stalking, blaming individual constantly for errors without proper reason, and arbitrarily taking disciplinary action against an employee, especially when people are working. Repeatedly singling out one person and creating trouble, insulting, humiliating, repeated attempts to exclude a person or isolate a person, humiliating in front of colleagues, engaging in smear campaign, spoiling the image and things like that, systematically interfering with normal working conditions, sabotaging places or instruments of work, whatever kits you have or instruments you have. Controlling the person by withholding resources. You don't give time. I don't give an appointment. The teacher says, I won't give an appointment. You have to keep on going and asking. Appointment only if you do this favor. This is a strict no. So looking at the vast list, you may be thinking now what to do, how to communicate. But remember that girls can't take advantage of the protective measure that is given by law. This is all to protect girls at workplace, at study environment, etc. But girls should not be unnecessarily troubling the men in our environment. If they have done, you can always complain. Simply you can't complain against a boy and spoil his image. As much as your image is damaged, the boy's image is also damaged. So simply to create trouble, you should not do it. Like you were in a relationship, now the relationship is broken, and then you want to put a problem for the boy, that is not okay. Now what is important is for girls to understand behaviors that do not constitute sexual harassment. What is not sexual harassment? You should not come up with complaint like this. If your male teacher says the assignment is not okay, this is not up to the mark, gives you comments 1, 2, 3, 4, do it and come. Now you can file a complaint against the male teacher saying that the teacher is doing sexual harassment. It's part of his job. It's part of the activity that you are involved in, wherein you expect quality work. You can't do that. So following up about your studies, why you are absent, why you have not come, you have attendance shortage, you face these consequences, the male member cannot be troubled. Requiring performance to job standards or study standards. You need to get feedback. If you have not done well, you need to get less marks. For that, you can't say it is sexual harassment. Normal exercise of management rights. Now, if I am a male administrator and you student complain against me saying that for such indiscipline, I suspended you. You can't say this male principal suspended me because he wants to do sexual harassment. You can't say that. Work-related stress, meeting deadlines, quality standards. Now, if your male teacher says the assignment has to be submitted on this day and the procedure has to be done on this day, it has to be done with these specifications. And if you don't submit and he scolds you or he writes a comment, it's not sexual harassment. Conditions of work or conditions of study. As a part of study, now you need to meet a teacher. You may need to meet the male teacher, the teacher happen to be a female or whatever. Now you need to meet your guide in order to get guidance about the project. Because the teacher has given you, say, deadlines, you have to meet me every week this day. It is not that the teacher wants to meet you all the time. The teacher wants to meet you related to the project. If something wrong has happened, what I discussed earlier, you can definitely file a complaint. But not because the teacher has called you to give comments or observations or inputs of the teacher. Constructive feedback about studies or work. Somebody says you need to improve your communication, you need to have eye contact, you need to be professional in your dressing up. It doesn't mean it is sexual harassment. So please do not misuse the provisions of the internal committees, guidelines or SOPs. Okay, so this is not sexual harassment. So most common form of sexual harassment is what is known as quid pro quo. So what is quid pro quo? It is this for that. You cooperate with me by sexual harassment, you tolerate. I'll give you full internal assessment marks. Or you cooperate with me, I'll help you complete your project on time. Otherwise, you have to study 6 years here. If somebody makes such comment or thought is there, it is known as quid pro quo. Literally, this favor for that favor. Adjustment that you do. This is not to be tolerated. If any girls face any minor forms of harassment, whatever we discussed earlier, with this thought in mind, the girls should always speak up and complain. It's better to nip at the bud than tolerate everything and finally you reach the ultimate problem. It should not happen. Next is creating hostile work or study environment. This we have discussed already. So there is no place for quid pro quo or hostile work environment in our campus at our university or its facilities. And you know, if somebody is sexually harassed, how disturbing it is going to be for the victim, professionally and personally. It's going to reduce the self-esteem, it's going to reduce job performance, it's going to affect the health and mental status. That's for the victim. Do you think the people who are harassing a woman will be free from any of these? They will not be free from issues related to profession or personal issues. You harass at a weak moment, but then you are going to suffer for life because it's going to damage your career, it's going to damage your personal lives. Because the information, you have to appear for so many investigations, big team of people will be there, they will be cross-questioning you, the girl will produce so many evidences. Then if the harassment has really happened, you will be sent away from college or workplace. You will be rusticated from the university. You may be suspended depending on what is that you have done. So it will definitely damage our professional lives. Therefore, let us be very careful when we deal with people of the opposite sex and have socially acceptable way of communication and relationship. So what the committee does, in case in future anybody feels that they are sexually abused or harassed, no one should be keeping quiet and sitting to themselves. If my friend has faced this, I should be able to support my friend or my classmate. Whether it is a boy, boys also can support a girl if they have been victimized. I mean, they are sexually abused. So that the girl will speak up and seek justice. That's very important. Having a supportive environment. Secondly, once I feel that I am harassed, I should file a complaint at the earliest. I faced harassment. Now what I should do? There are mechanisms in our website itself. Online complaint you can file. You can mention your campus ID, your mobile number, some details about which group of student you are and what is the problem. That's not enough. With that, your complaining procedure is not over. This is for us to contact you in case you are not able to contact us at the committee. So after you have done that or without doing that even, you know, all over your colleges, in every block, there is a poster on prevention of sexual harassment. There are also names of the committee members and the phone numbers. You can call that number and ask where you can meet that person. Now, you need to make a physical complaint in a paper. It should include who you are, your name, your details, phone number or email and all that. Who is the person who has harassed you? Now the context. When the harassment happened, what time of the day, which place, who were the people around at that time, how it happened, whether any mobile imprints are there, or you have any photos, or any text messages, emails, anything that is done, recordings, all that you have to give as evidence. And you can seek justice from the committee. Now, I have complained against a male colleague, and later the male colleague will come and say, sorry, it happened like that, you misunderstood it. I can even accept and forgive that. We can reconcile. But you should not be forcing me to withdraw the complaint, saying that, see, how dare you complain against me, I'm going to throw acid on you. I see that you will not study in this university. I'll see you outside the campus. Such type of incidents happen. Now, that is not okay. The withdrawal of complaint should be voluntary by the woman. If the woman feels okay, forget it. Again, it should not happen. But if the woman feels that the complaint has to continue, within 7 days, the committee will contact the person who did the harassment and will give you a copy of the complaint for which you are supposed to reply if you are the person who abused that particular girl. You give the reason. Many men, when we call for inquiry, they will deny 100%. I have not done it. I am not there at all. But again, evidences are there. The reason why the girl should write date and time is because the earlier you make the complaint, we can obtain CCTV footages from whichever place it is available, or evidences of any witnesses we can call for. So within 10 days, the boy is supposed to give us the reply. Meantime, we also tell the girl, if at all you have any further things to talk to us or give us as evidence, you give. The girl will come with hundreds of pages of WhatsApp messages, videos, everything. Again, the boy will say, the girl is the one who sent messages first. So, boy also will bring so much evidences. The committee is having male members and female members. It's not just female dominant committee. The committee has responsible male members who are part of the inquiry. So we will not be one-sided. Committee will not support girls only, always. Committee will examine objectively. The committee can call the victim and then the person who is the respondent separately. Together we will not be calling. So once the inquiry is done, the committee will submit its report with recommendations based on which, if you have done wrong, action will be taken. Now the boys may be asking me, what if the girl has done a false complaint? If the girl has filed a false complaint, then the action will be taken against the girl. Same action what will be taken against the boys will be taken against the girls. So therefore, no girl should be filing a false complaint. Okay, so this is the procedure. Now, if we have done inquiry and we find that there is no sexual harassment or it is a false complaint, the girl who complained is not happy with our recommendations, the girl can say, we don't trust the university committee. Now I will go out to the district committee. Because in district, there is a district committee which will handle all such referred cases. So the district committee will take over and do the investigation. So this is how the committee functions. We expect that this sort of awareness program will help all our boys to be aware of what is sexual harassment, girls also to be aware of what is sexual harassment and what is not sexual harassment. It is also teaching you how to handle a problem, what you have encountered, so that such problems can be reduced or controlled in the university. So this committee has a lot of powers. This committee is also creating awareness so that we have no cases of sexual harassment at our university, so that all our students will be safe in this environment. So therefore, let us be very responsible in all our communications and behaviors. And the details are again there in the website. Under committees, it is internal committee. You can read the SOPs and how the grievance is redressed and further details. This is what I mentioned about online filing of complaint. We don't trust this 100% because anybody can simply put somebody's name and send it. We will not start the investigation here. This is only for us to contact the aggrieved woman. Okay? So this is the online complaint forum. Any questions? And please remember that our university considers that all students should be safe in our environment, classrooms or outreach centers and all places, and has zero tolerance towards sexual harassment. In order to achieve that, we have CCTV coverages in most strategic places. Lights are available, security personnel are available, common rooms are available, continuous monitoring of CCTV is available, and visitors are restricted. Orientation programs like this are done so that we will not have such cases of sexual harassment which will be damaging to individuals. At the same time, if such incidents happen, it's also damaging the reputation of the university. So therefore, we are extremely careful about what happens with regard to sexual harassment. So I wish you all safe learning and a productive learning environment. Please do not tolerate any forms of abuse or violence that you face at this university. Now, boys may be asking, it's all about girls. What about provisions that we have to protect men? I'm not talking on behalf of men. I'm talking on behalf of this committee, which is only talking about protection of women at workplace or study environment. Okay, thank you. Any questions? You are welcome to ask.
Thank you, Dr. Leena, for your valuable session. Your commitment to promoting a safe and inclusive environment is truly commendable. Now I request Mr. Prabhakar, Assistant Professor in the Department of Medical Laboratory Technology, to present a token of appreciation to Dr. Leena. I am pleased to present a brief overview of our last speaker, Dr. K.S. Ali. Dr. Ali holds a PhD in Library and Information Science from Mangaluru University, awarded in 2019 for his research on web-based technologies in libraries. He has cleared UGC NET twice and KSET and holds a postgraduate diploma in Human Resource Management. With over 15 years of professional experience, Dr. Ali has served in various library roles. He is currently the Chief Librarian and Assistant Professor at Yenepoya University, a role he assumed in January 24. Previously, he was the Deputy Librarian and Assistant Professor at Yenepoya and has held key positions at Farooqia Dental College, DM Vahanad Institute, Accenture, and IISc Bangalore. In addition to his professional work, Dr. Ali is actively mentoring PhD students contributing to research in scientometric studies and IB library services. I now invite Dr. Ali to the dais for his talk on orientation to library resources. Sir, can you please join us to the dais?
Thank you. Good afternoon. Good afternoon, everyone. So, I am the Chief Librarian. So, I will going to explain about what resource we have for your course in detail. So, what library facility we serve for allied health and during your course. So, we have print resource, online resource, and internet facility, and reading hall facility, and are so many other facility for learning purpose. So, whatever I explained, try to write down because it will useful for you in whole course. So, dedicatedly we have subscribe, we have purchase, and course-wise resources also. So, it is very much important for you. Maybe it is a first, orientation day, how much you will understand, I don't know, but if you return whatever I say, definitely useful for in your course. Within few seconds, we'll start the presentation. In meanwhile, if you have any doubt related to resource, learning materials, so you can ask. Okay, we'll start the session. Sorry for interrupting. So, as I said, so we have huge library and resource facility. So whatever I explain, please write down. It is useful for your course. Okay. So these are slides what I am going to cover. First of all, about library I am going to explain. So rules, regulation, vision, mission, and library timings, and also what facility for sitting facility we have across the campus, and library membership, and borrowing facility, and remote access and other things, and print resources, online resources, and what type of service we provide for our students and faculty members. So many things we have, so please listen carefully. So about library, we have 8 library including central library. For allied students, we provide central library facility as well as your Constitution College library in the Mudipu as well as in the Kenya campus. So overall 50 departments library also we have in the across institutions. So we have sufficient budget to acquire the resources. So this is the milestone. So since 1992 to till date, we have so many library established based on the college establishment. And also we have dedicated library websites for the service purpose. So Central Library will provide facility to all the Constituent College Library including allied health. So whatever we acquire, subscribe, service, automated, everything from Central Library. And all the students connected to main campus. Our vision is this Yenepoya Deemed University Library seeks to be central hub for the information and a leading center for intellectual development and learning. It serves to provide expectational resources and service to support university teaching, learning and research objects. So facility, as I said, we have sufficient reading halls across campus. All the reading halls are AC connected. And everywhere, all the libraries are Wi-Fi, internet facilities available, and CCTV control for the security, and RFID for resource control purpose. And this is the brief about sitting facility, because every campus they need library. So we have more than 1,500 sitting capacity at a time. So this is the brief screenshot. So this is the central library. After your orientation, every batch wise, so there is a visit to central library and constituent library. So just an example. So this is a main entrance for central library, biometric access for using the library, property counter, and circulation desk, reading newspaper and book sections. And e-learning center we have dedicated to, sorry. Okay. So audiovisual rooms and journal sections, everything we have in the central library. And Constituent College Library. So this is allied Yenepoya Ayurveda College. So in Kenya campus, allied students can utilize the Ayurveda library. And homeopathy library also facilitated to allied students. And dedicated allied library in the Mudipu campus. This is a screenshot. And we have degree college in the Mangaluru city. So this is the campus library. And we have general rules regulation. Everywhere we have biometric access and ID card. It is mandatory to visit. And also maintain silence and other common rules regulation in all across libraries. And this is important. Library timing. So central library functions from 8 morning to midnight 12. During exam 9 to 12. And Constituent College Library 9 to 5. After 5, so majority students, allied students, they can visit our central library. And after 1 or 2 years, another central library will open in the Kenya campus. So library membership. After your admission, default you will get membership, but you need to apply 3 photos to get a membership in the central library as well as Constituent College Library. Membership is free. And you will we will issue UG 3 books and PG 2 books for 3 days and 5 days, and Research Scholar 2 books. And after the end of your course, you need to get NOC mandatory. No due certificate is mandatory to get the certificate, course certificate. So as I said, all the libraries are automated, everything is computerized, and surveillance, CCTV surveillance and RFID radio frequency identifier technology we use for secure the books and transaction purpose. This is important. We have libraries dedicated website, so where you can access whatever I explained, everything is available in this platform. You can visit library.yenepoya.edu.in, whatever I am explaining, everything I have mentioned in the platform. This is important. Then print resources. So we have huge resources, more than 65,000 plus books we have in across the libraries, journals and back volume thesis dissertation. Dedicated to allied health science students books, we have more than 7,600 plus print books. These are only I am explaining about print books. Next, so whatever print collection we have, you can search the online. That platform called Online Library Catalog, OPAC we say. So just visit to opac.yenepoya.edu.in, so where you can search whatever resources we have in the library. So just you need to type the keyword or your related books. You will find the where books are located, it is issue or return or which location available. So OPAC, this is the another website. So now, if you want to see your previous year question paper, see, before exam you need to refer your previous year, means your senior's question paper. So everything previous year question paper we have uploaded in this platform. This is institution repository. So this all be connected to library website. You can just go to visit a library and you can see the previous year question paper. So it is available. In respect to your course, you can download, you can refer for exam purpose. Now come to online resources. Till now I explained about the print resources. So online resources always two type. One is subscribe, purchased by university. Another is open access available for public freely. First I will explain subscribe resources. So we have huge resources. As I said, Web of Science, up-to-date, ProQuest, Clinical Key, JP, CBS. These are different publisher-wise and aggregator database. So we have 8 online database, 13,000 plus e-books and 2 lakh plus e-books. So first one is Web of Science. Web of Science useful for literature search and research what's happening in your subject area. So this platform useful for especially faculty members, PhD and PG. And UG, if you have dissertation work, you can use this platform. These are subscribed by Yenepoya. Next, if you want to know about clinical side, this platform called up-to-date evidence-based solution for health science field. So here, if you want to treat patients live, if you want to know about drugs interaction, if you want to have any doubt related to patient care, these are platform. These are also subscribed by Yenepoya for clinical purpose. Next one, ProQuest. This is a completely full text database. Means whatever you want to download in PDF form or whole book if you want or article you want, you can download in this platform. These are also subscribed by Yenepoya. This is a complete package. So here more than 13,000 plus e-books and 2 lakhs plus 13,000 plus e-journals, 2 lakh plus e-books are available. Next, same platform, if you want to browse, if you want to explore more on ProQuest ebooks, this is the platform. So here you can browse subject-wise. For example, if you want to browse about psychology or if you want to browse about image technology, you can browse here. So many books are available. In live demo, I will try to explain how to access this all. So this platform called ProQuest ebooks. Next one is ProQuest thesis dissertation. I hope UG, PG, they have end of the semester dissertation work. So dissertation purpose, if you want to see the senior dissertation worldwide, and if you want to refer any dissertation or you want to see the duplication of dissertation work, this is a platform. So ProQuest, this is a dissertation platform. Next one is Clinical Key Flex. So I hope you all know about Elsewhere Publisher. So Elsewhere Publisher is an international publisher. So the international publisher, they provide the health science collection in the clinical key. So So in two types, one is Clinical Key Flex for PG and research oriented resources. Another is Clinical Key Student for UG students. So this also available in the Yenepoya. These are all full text. What I am explaining, all full text PDF form or HTML format. Next one is Clinical Key NCG resources. Means if anybody wants to study on oncology, cancer related, these are dedicated platform where you can find the research and full text ebooks and PDF. Next one is JP. So Indian author written books are available in JP platform. So students majority they prefer JP books because the content is focused on Indian scenario. So JP digital is completely ebooks and e-journals. So especially UG students, they more refer. So this is also available in Yenepoya. Then CBS, this is another platform where medical related books, for example, Chaurasi Anatomy. So many books are available under CBS. So this is also available in our campus. And Wiley, if you want to focus, you want to study on dental related research, dental related anything you want, this is a platform we subscribe for dental students for Wiley. Then Theme Med1 communication science, these are completely dedicated for audiology, ENT, odontology. If you are ready to, if you want to study about the audiology, speech and hearing, or pathology related, the books and journals are available online, digital collections. Next, this is a special one. I hope everyone read newspaper and magazines, especially you are in Malayalam language, or regional language or English. So this is a platform we subscribe and October 1st onward is available. Whole more than 9,000 plus collections means Malayalam newspaper, Malayalam magazines, English newspaper, English magazine, Kannada newspaper, Kannada magazine, everything digital format in PDF format available. So this platform can be accessed in IP. So if you are connected to our internet or Wi-Fi facility, if you have, you can access. So for Week, Times of India, Times, Economist, or Outlook, or the Hindu, or financial, business related, or even entertainment related. So whatever you want as a general. So we have providing for this, for all the students in the camp, in the university. So the platform called EDSTAR, EDZTER. So all this link has been given in our library website. Now, whatever I have explained, you can access within the campus, which is connected to our university internet. If you are in home or even hostel, if you are using your personal internet. So how to access? By personal internet, you cannot access, so whatever I said, but you can access through this platform called Nimbus, the remote access or half campus resource access platform. So this is important because if you don't have user ID password, you cannot access our resources in out of the campus. So if you want this platform user ID password, you need to register yourself, or you need to give your detail to your class teacher. We will provide. So all the resources is connected to in this one platform, which is user ID password required. Without user ID password, you cannot access. The platform name called Nimbus. In live session, I will explain how to access this all. Next, we provide a lot of library services. As I said, the book borrowing facility, new arrival, whichever we have received, as a rack facility in all the library, and newspaper clippings, current awareness service on your subject area, and email-based service, and whatever you have query, we answer through email. And especially for research and publication, we have a lot of service because it is a focus on research related. And we have Grammarly. If you are interested, Grammarly Premium, you can approach, we will provide, and lot of other services. So as I said, we have subscribed Grammarly and Turnitin. If you have dissertation work, especially PG students, they mandatory to do this plagiarism check. I hope this is for PG. Then Mendeley for reference management tool service. So usually we keep on providing lot of training sessions for all the users, UG, PG, PhD faculty members, whatever, author workshop, whatever the new updates comes, we'll give the training. So this is important. Whatever I have explained till now, these are URLs, so websites, so where you can access all. So library websites, university website, catalog, institution repository, remote access, and other few important platforms. I will try to give demo on library website, WAPAC page means library catalog page, and remote access and few e-resources. So these are the important email IDs where we provide lot of services. First one is library@yenepoya.edu.in, where you can, if you have any query related to resources or library issue, you can ask. You can mail us, we will answer. And if you want e-resources facility or issues or any suggestions or training required, you can mail us on e-resource email ID, we will provide. If you want any research support service, we will have dedicated service. And also if you want full text article service, they are dedicated, and plagiarism service, another email ID. So before going in demo, if you have any question, you can ask, or I will try to explore in the demo. Okay, this is the website, what I have shown now. So here we have mentioned, categorized whatever content we have organized in the content manner. So organized content, so about library, print resources, and e-resources, digital library, and other open access resources. So in this one platform, you can access all the resource content. So first one is, we'll try to explore, if you want to know about library, you can visit, you can explore yourself. First one is library catalog. If you click to library catalog, it will redirect to this platform. So here, as I said, if just you type which book you want. For example, psychology book you are searching, just I will type psychology, and there is a different libraries. We have 7 libraries currently. If you want to search in allied health, you can search in, select allied health library and search, and it will display. So if book is available in the allied health library, the book will say Handbook of Health Psychology. So if you just click, and you will get more detail on that. See here. So how many books and what is the status? Issue. Issue means you can borrow the books for your home. So that is the status. If it reference means within library, you need to refer. So available, this is the status available, it can be borrowed. Similar kind, you can search whatever book you want. Instead of searching in the allied health, you can select all, you can search. Similar books are available in the central library also. You can issue it. Central library also, you can issue the books if you require. See, psychology for student, for nursing students. So many books are available. Another one is, so as I said, we have new arrival display service. So in the same platform, whatever new books are purchased, so library wise you can see central, the YCL means Yenepoya Central Library received new books called pediatric nursing. Similar, like every library, whatever books are received or purchased, displayed in this platform. See, allied health library received the complete poetry one books. Like that, lot of books are keep on we are purchasing. So new arrivals, you can be searched, you can see in this platform called WAPAC, Library Catalog Platform. I hope it is clear, right? I'll move on to next one, which is important for you. Previous year question paper. See here, previous year question paper. If you click to that, within the campus, you can access this. This is a local host platform. For example, here subject wise or course wise we arrange BSc Anesthesia and Operation Theatre. So just I will click to this subject. First year question paper, if you want to refer, click and go to by date or title wise. See, so many 4 years question paper we have uploaded. So just click to view, PDF will open. You can download, you can take the printout. That is the advantage of the platform. Within a second, it will open the full previous year question paper. See here, more than 7 pages. So in same semester, maybe multiple question paper we uploaded in the same platform. So in same platform, we have uploaded your thesis dissertation, which is senior thesis dissertation. So in same platform, you go to home, so you will find the faculty publication, previous question paper, thesis dissertation, and other. So now we'll go back to important one is online resources. So if you click to online resources, we have given link to all the page, all the whatever we have subscribed. As I said, Web of Science, ProQuest, UpToDate, and even remote access and theme. So first I will click to ProQuest, which is highly useful for you. For example, image technology, I will type. Just I'll search in general. I don't select any journal, books and all. Just, okay. Within 5 minutes it will get refresh. See here, image. It will suggest. See here. Almost all the collection, all the subject area collection we have, it have. And once you see 7 lakh plus collection, but if you are looking for books only, you can limit to books. See, so books also, lot of books are available. You just select recent, last 5 years publications. You can limit it. See, 8,000 books are available on CT, image technology and other. So these are completely full text resources. For example, I want to open one. Just I will open the first result. Image processing. So here, read offline, online. You can read it at a per day. You can download one book. Per day, you can download one book or chapter, 3 to 4 chapter. You cannot download multiple books in PDF form. So within a second, it will open. It depends upon internet speed. See here, in PDF, you can see this complete books. The example I am showing because of time also important. If whatever I am explaining in the platform, you can explore from your side. You can go to our library website and you can explore. So this is the example. Now come back to another platform called here. Go to ebooks. Dedicatedly we have given link to ebooks. Here just click to ProQuest ebooks. So here same keyword you can search. See here, you can see here also you can see last 1 year ebooks, which is 1 year last purchase or 2020-24 published books. Even general books also, motivation books also available. If you are interested, you can read it. Next one, we'll move on to JPE books. As I said, Indian authors more preferable, means Indian students more prefer to read these books. For example, clinical care medicine, emergency medicine students are, for example, I will open one Asian obstetric OBG books, just for example. You can explore yourself, see lot of subject wise it is mentioned here. You can anatomy, if you want to read anatomy books, you can refer anatomy books, biochemistry. So all the medical related books are available in this platform. So same CBSE books also. CBSE books also, especially Chaurasia is a famous book for anatomy. See, pathology seminar books, pharmacology. So one I have opened for demo purpose. See here, whole PDF you can be view and you can download. So this all, whatever I am explaining, everything is available in our campus internet. If you want to access these resources in half campus, as I said, you need remote access. So remote access tool called Nimbus. See here, what Chaurasia anatomy, human anatomy. So you cannot download, but you can read in online. See, you can partially copy the text for your presentation or assignment. Another product called Elsewhere books. Elsewhere is a clinical key product, means Elsewhere is a publisher. So international authors are standard books in your subject area. So those books are available in clinical key. So here also a lot of books and journals available in the platform. So it is connected to our internet. So another what I said, remote access. It will take time to open. So go to our website and half campus. You can click to half campus. So here we have given link, registration link, useful link, and everything. So this is the platform. Here to access this all, you need login ID. So we'll create login ID for you if you requested through proper channel, or you need to fill the Google form. So we have given organized content here also, UG, PG content, e-books content, e-journals content. So half campus, which is subscribed by Yenepoya, especially we have mentioned in this platform. So one example I will show you, Medno, which is audiology, pathology related content, where you can access. So here if you get username password, so no need of our Yenepoya internet. So even private personal internet also you can access. See here, so name, it is appear as a Yenepoya deemed to university. So it means it is accessible through your remote access. So go to books. You can offline, you can read, you can download the books, you can read it. For example, one I will try to download, Essential of Audiology. See here, complete books can be readable in the PDF HTML format. Within a second, PDF also available. See, you can view in the PDF form. Like this, you can explore yourself whatever I have explained. So don't forget about library website. Say chapter wise, you can download the PDF form. See 29 page PDF chapter is open. Do you have any doubt on our resources? Another one called this is the main newspaper platform where whichever I have explained. See, so dedicatedly we have subscribed to Yenepoya for education purpose. This is a general platform. So if you are interested to read general books, general newspapers, magazines, or whichever you even education related magazines are available this platform. This also we have given link to our website. So you can visit, go to e-resources, subscribe resources, somewhere other resource, under other resource I hope. We get to add. October 1st onward is available. Other than that, everyone, if you want to use general important national digital library, which is in Government of India provide lot of open access content. So open access content can be accessed for your competition exam purpose or even for skill improvement purpose. If you want to learn new skills, the resources available in National Digital Library India freely. Registration is free. No need of payment, but you can utilize. So course-wise, say higher education course, or career development, or newspaper clippings, archive, lot of resources are available. Like this, you can utilize. I hope I have explained the resources. Now open for questions. Do you have any query questions? Any doubts on resources? Individual course-wise, we will orient in the library. So this is the general platform. What we have in the university, I have explained. So if you have any doubts, you can ask us or you can contact individual when you visit. We will try to explain. So thank you.
Thank you, Dr. Ali, for this valuable orientation on library resources. Understanding how to utilize these resources is truly crucial for academic success. Now I request Ms. Rashida, Assistant Professor in the Department of Hospital Administration, to present a token of appreciation to Dr. Ali for his contribution. As we draw today's program to a close, I would like to take a moment to express my heartfelt gratitude to all our esteemed speakers for their invaluable contributions. I would also like to thank each one of you for being here, engaging and creating a dynamic atmosphere fostering a spirit of collaboration and growth. We hope that the knowledge shared today will not only benefit you in your respective fields but also inspire you to implement what you have learned in your professional practice. As we part ways, let's carry forward the lessons and connections made here today. Wishing you all a wonderful day ahead, filled with inspiration and motivation to continue pursuing excellence. Thank you all once again. So the buses will be here by 4:30. So I would like, if anyone is interested in showing some special talent, singing, mimicry, you are open, the stage is open to you, so you can come and show us your talent. Anyone, faculty, students, we don't have any problem.
So guys, please come up. Those who know how to sing any BOT, BPT, RT, RDT, anybody? MIT, MLT, all the please come. So faculties, please send some students from your department. Anybody? Why no 2023 is actively participating? Come on the stage, no? Voluntarily, please come. Come up. Or else we are going to take another session. Then come. Anybody?
Good evening. Myself, Naifa TK, AOT program.